Then John, do we need to say something as far as the recording goes and just kind of the how that works? All right, we're halfway, 16. Once again, the invite is open if you want to just turn on your camera, say hello, or let me see your faces. And you do not need to, but you can. I shall unmute. So welcome everybody and we'll get started. We're expecting 30. So let's see. Let's go ahead and I'm going to mute everybody. We got it all. Okay, so I am Jennifer Wright. I'm a certified nurse midwife. I'll be the talker tonight, the voice of your childbirth education class. I've been with Kaiser 8 years. I've worked in a vast variety of practices, so including New Zealand, Indian Health Service, private practice midwifery, and now Kaiser. And so part of this childbirth education class is sharing with you the information that I wish I had time to discuss with you in our very busy clinics. And so that's part of the reason that this is happening at 6:30 at night, and that I work a full clinic schedule or my call. And then this is extra time outside of my full-time job. So I know it goes until 9:30. We will be very busy all the way through. So just make yourselves at home and comfortable. And there's very little, I'm not going to have you meet in breakout rooms or really interact. We have 30 people that are on tonight. And so it'll mainly be information coming out at you, which I find most people that's what they're hungry for. So the one way that you can communicate with us is on chat. So the chat function is the little bubble that's up top. It says show conversation. Everybody should be able to see that. If not, simply unmute and just shout out a question. That's okay too. Our chat person tonight is going to be Sunny. Do you want to say hello?
Hi, I'm Sunny. I'm one of the labor and delivery nurses here, and a lactation consultant. So if you guys have any questions that you just want to type while Jen's talking, feel free. If I don't know the answer, I'll just come knock on the door and ask her. But yeah, if you guys have any questions, please feel free to ask.
Wonderful, thank you. So Sunny's at a computer that's actually out in one of our nurses' stations, so it's she can hear me, but she can't unmute. There's no microphone, so she'll be the voice behind the chat tonight. Okay, so full 3 hours. I recommend also now that I can see beautiful faces and I know there's real humans out there. If you want to turn your videos off, hello. I recommend it. It'll make the videos go a lot smoother. So welcome everybody. So I've been with Kaiser 8 years, but I've been a midwife for 22. I love what I do and I love educating about midwifery and physiological birth and how this process is going to work to bring your kid out into the world. But I think you'll find that part of this class too is a reminder that it's parenthood. You're going into parenthood. The birth is just a rite of passage to get to that parenthood spot. So I am actually in a postpartum room tonight because our labor rooms are all full. I think that crazy full moon and eclipse is coming up. So I'm sure that's why our rooms are full. But I think it's appropriate to show you the postpartum room because it's also going to shift you into parental mode, right? And thinking about, oh yeah, this is not about the birth of the baby, but this is about becoming parents. So we have, just to kind of orient to our hospital, we have 9 labor rooms and we have about, I think there's 20 of the postpartum rooms. So you'll be in this postpartum room, usually a full 48 hours, 2 days after birth. If you're an experienced mama, then you'll be in there for about 24 hours. Obviously, we're not going to send you home at 2 o'clock in the morning. Well, so you would spend the night with us in that case, and we'd send you home in the morning. Most of the time, if you're being discharged home, it's going to be about afternoon or noon, just so that we can get baby evaluated, mama evaluated, and everything going that way. So welcome. So let's do a little tour. I have decorated the room also. Just mute here. Let me take apart here. So there we go. So this is one of our postpartum rooms. So when you come in here, the light's doing funny things. So we have a bed. The difference is we have a cot for baby too. And then we have a sleeper chair over there for your support person. So I've done a little bit of a blend, kind of how to pack for labor and delivery, but also postpartum. So one of the things that you'll notice in this room is the cot for baby. So you will get a nice little welcome packet, goodies from Kaiser. And then downstairs, oh, no, it's okay. I've got it. I'm got used to that. One of the things that's down here is the Pampers, the wipes, and more blankets. So you don't need to bring those things for the initial time. Over here, we have the whole major players of tonight's class. So meet the pelvis, meet cervical dilation, and meet the uterus. And there's a little baby inside there. So let me see if I can show that to you. Okay, so bag of water breaks, right? That's where this is the cervix, this is the uterus. So this is going to be inside your pelvis. And so we access the cervix through the vagina. Okay, so inside here is the vagina, and then there's the cervix. So inside there, you can see the baby starting to crown. And then as the baby, this one's going to come out in the sac, which is so beautiful. So that's what it looks like. There are 2 layers to the sac. And we're going to talk about baby's head position and how important that is, that they're lined up with baby's back towards your front so baby can come down and turn a corner with their head. They have much more range of motion. This will make sense as we go through the class, but I just want to introduce the parts, okay? And then baby comes out of the sac and is attached to the placenta. That's the cord, and baby goes right on your tummy, and then the placenta comes out. So those are the parts. If the baby comes out a different way, the little zipper on here is kind of an illustration of where a cesarean incision would be made. So here's the pelvis, so it's just above the pelvis. And the cervical dilation is just how the cervix is moving through through labor. So fingertip all the way open, which we say 10 centimeters, but it's basically that we can't feel it anymore. Okay, so there's our players. Baby's very important in there. This is a depiction of kind of the road to labor. So Penny Simpkin is a physical therapist who made this drawing. So there's the yellow brick road, and then there's the super highway, and then there's this bumpy road. And so what you can see is that there's a lot of time going by. So she's got the clock in different spots, and the different spots where there's dilation that's going on too. The bumpy road is when baby's not in the best position. Like I said, that baby can't come around the bone and move into your pelvis. So that's where there's a little bit of back pain that can come and different things to try. The superhighway is more of a high-tech process when a woman gets an epidural, and we'll watch a video about that tonight. But the time still takes a little bit longer, but there's just not as many shifting going on because mom's usually just resting with the epidural. So I love that. So Penny Simpkin, the roadmap of labor. So other things in this room. So you can bring your own blanket. I'm a big color person and cloth person, so I'm a big advocate for bringing your own. Maybe you want your own sheets too, just to have that smell, your own pillows to have the smell of home. Over here, there's the menu card. So we have room service for our admitted person, and then your support people will go down to the cafeteria, which is on the second floor. They're only open until 5:30, 6:30 p.m. And only open at 7 a.m. So having some snacks is a good idea too. So I've got a little snack table over here. Sorry, my camera seems to take a little bit of time when I move the computer. Did it go? I think it's shifting too easily. There we go. It's a little snack table. So maybe you want to bring your own cups, a special cup. Chamomile lavender tea is really, really soothing. Snacks, salty snacks. Maybe you want granola bars. I highly recommend, and I swear I don't get paid by them, but the Liquid IV, it's just electrolytes that go in water. They taste pretty good. Not as many artificial colors as in a Gatorade or a Powerade. So you can definitely bring snacks with you. So also have the balls over there. So we have the yoga ball and a peanut ball. So those we supply. So you don't need to pack that in your car. You'll have enough things to bring in. But those are really good for being up out of bed. Or if you've got an epidural, the peanut ball is wonderful for helping to shift your pelvis around too, to allow for baby to come. Again, another blanket. Maybe you want to bring some of the little fairy lights just to, I don't know, bring a little bit more of your own personality to the room. This is the sleeper chair, so it folds out to being about like a twin bed. You may want to bring your own sheets. We will give you sheets, but they're the hospital plain white sheets that are kind of starchy. Sense of humor. Maybe you want to bring the magic 8-ball, you know, is my baby coming today or tomorrow? Will it be today? And then you can ask it. It says, as I see it, yes. And then just depiction of time, bananagrams, Scrabble, electronic games, just because labor can take time too. And if you have an epidural, you will be able to probably sit, if you're not resting, napping, to sit and play a game or solitaire, watch movies, so pack that. You also may want to bring your speaker and a playlist, so you don't have to skip that song, get music that you really like. Down below here, we've got the cooler bag, and that's important too. If you're going to take your placenta home, you'll definitely want to have a cooler ready to put it in, and usually we recommend it goes home the first day. I think massage is important. These are tennis balls in here, and they're really good for your support person to rub on your back. Sometimes it gets really hot, so a nice fan is good to pack. Aromatherapy will support you for that. Bring your own diffuser, your own oils. We do have some. I usually have a little lavender oil and clary sage in my pocket when I come around. But you can definitely bring scents that smell good to you. And the bathroom in here is a little different. I recommend wearing your own clothes. Somehow, when you come in labor and we give you a hospital gown and you go and change and then you come out, I've seen women forget their personalities in the bathroom and they just become a patient in the bed. And you're not. You're going to be a woman in labor, a person giving birth. You need to be empowered and you need to feel yourself. So wearing your own clothes can kind of add to that. It's a little just a little mindset, but it is important, right? You know, ours don't say property of Kaiser, but you know, that message, right? We give you a gown that says that it belongs to us, you know, that we totally will let you wear your own clothes. Frida Company has some great gowns now that are out there. So the bathroom has a little shower and toilet. We'll bring in a chair. So the difference between this bathroom, you'll see a picture of our labor tubs. We have 2 rooms that have a labor tub. So I'll show those later. But the difference in here are all the postpartum things. So we've got pads. These are ice packs. We have the lovely disposable undies that are in here. And the squirt bottle. That's a must after you've had a baby. There's still going to be some mucus and some bleeding, and so using warm water with a squirt bottle really feels good and just keeps you nice and clean. So once again, I've got little in the shower, I've got the little lights in there just to give it a little bit more homey feel, right? It's a hospital room. We try to hide as much of the items that we can, but if you feel more at home, then you're going to feel more empowered also. Okay, so were there any questions from that tour? Got lots more that we're going to go through tonight, so thanks for that. Okay, and in the chat, there's a couple links. There's one of my favorite animated birth videos that a lot of times I like to show, but tonight we'll focus more on the slide presentation and the videos that are in the presentation. But the animated birth video, this physiological birth, and it's just a good reminder that on any given moment, any given day, all over the world, somebody's giving birth, right? So you're becoming parents, just so that it's just that reminder that you're not alone and that our bodies are made to do this. Because we walk upright, we need a little help. You need a midwife, you might need an OBGYN, but that video I highly recommend. The other link I put in the chat is for the KP in Hawaii maternity section, so specific information to us. There's also La Leche League, which is the breastfeeding community, and then Spinning Babies. And Spinning Babies is a way for you to have a tool of how to avoid that bumpy road of back labor by in your pregnancy doing daily exercises that are recommended and weekly exercises to help your ligaments, your fascia, your muscles in your pelvis all be perfectly lined up so that baby can come through that pelvic bone. So spinningbabies.com, I highly recommend that one. Okay. All right, so now I'm going to share my screen and we'll dive into the actual class tonight. From the beginning. Okay. So, Sunny, if that's not looking right, come in and tell me. So welcome everybody. I have Crystal's name on there. She's helped me before, but Sunny is helping tonight. I love the beginning of this slide because what is it showing you? It's not showing a newborn baby, but actually grown children. And again, a reminder that we're going to talk about childbirth education, but you're actually becoming parents. And I think when we discuss childbirth education, it's important to remember that this the childbirth piece is to get to the parenthood. A reminder with Teams, so the chat function has a little blue arrow that's pointing to it. You should be able to type in there. If you're unable to type in there, please just unmute and ask a question. I should be able to hear you. During this part where I'm sharing my screen, I do recommend that you have your video off. I think our videos will run more smoothly with that. And then keep in mind that you can see who is on tonight. And so if you recognize a name from your childhood, please respect that now you know that, yes, they're pregnant also, but to not go on social media or share that information. By all means, if you want to reach out to each other through that chat function, you sure can, but just kind of keeping confidential. And questions are welcome, and keep in mind, some people get intimidated asking questions, but a lot of times the question that you have is maybe a question somebody didn't even know to ask, right? So please keep Sunny busy with those questions. I am at the YPO clinic, so if you want to come see me there, you sure can. I have 2 days of clinic, and then I'm 1 day shift here and 1 night shift. So I may be seeing you when you're in labor. I also want to shout out to Hilo. I think we have a couple that's on from Hilo tonight, and Maui. So the specific labor room information is going to be different for your hospital. So make sure at your next clinic visit to have a chat about the rooms. The items that I showed you for packing, you can definitely bring with you to Maui also. And the items that I showed you that are in the rooms that we supply for you, the pads, the peri bottle, the diapers, the wipes, Maui and Hilo will also have those. So just a little bit different. And then everybody except for a couple are in your 3rd trimester. So this class is best when you are thinking about how is this baby going to get out of my body? So 3rd trimester, so after 28 weeks, sometimes if you're a little less than that, it just seems too much, right? Because you're still enjoying the pregnancy. But for the most part, everybody was into their 30 weeks, and we have a few that are due any day. So I'm glad you could all join us. COVID updates, so visitation and labor support has been relaxed. So 2 people can join you. So we still have a limit on who can be in the room. They need to be over 14 years old, but you can have 2 people here, and we're no longer checking vaccine status, and we're no longer checking a COVID swab if they were unvaccinated. So that's great news. We will still test you when you come in. The admitted person will be tested for COVID. So we're also doing RSV, the respiratory syncytial virus that has been in the news recently, and we also test for flu. So we're really lucky that we can do those 3 tests with the admission. If your support people are feeling unwell, have a backup plan, because we really would ask that they not join you if they're feeling sick. Even if they have a test and, well, it's not COVID, but it still could be the flu or that RSV. So we just ask that you have healthy people with you. We do want you to wear your mask while you're in the hospital, and they do have them at security when you check in, but you can bring your own. Once we have established that you're negative, we are a little bit more lenient, but you will notice we are still fully masked. And if you were COVID positive, we'll be fully in the PPE. So that personal protective equipment. So I really advise, I have two things that can keep you safe from COVID. One is the mask. So I know it's not mandated, but in third trimester, you really may want to put it on. Just especially as we're going into the fall, the colder weather, more indoor time and family gatherings. So you may just want to keep that mask on and still limit the intimacy that you have with big groups. And then the vaccine is highly, highly recommended in pregnancy, and the booster, the new booster that's out. So it is, when you do have COVID in pregnancy, it seems to affect the placenta. So that's why the vaccine seems to give an extra layer of protection. If you get COVID in pregnancy, we will offer you the antiviral medication, like Tamiflu is for flu. We offer Paxlovid or whatever the antiviral is for the particular variant of COVID that we've got. So those things will be offered to you, and the vaccine is highly recommended. It does seem to reduce the risk of a hospital admission during a COVID infection. Keep in mind, in pregnancy, your immune system is already compromised because your body is not wanting to fight off that baby, right? So that's why you are more prone towards illness in pregnancy. So consider the vaccine, update your boosters, and just be safe as we go into a holiday season. Okay. So childbirth education, I just want to put it into perspective. If you look at your pregnancy, that's generally 280 days. Breastfeeding is going to be longer than that. And then if you look at the little tiny sliver, the actual active labor, which we'll talk about what that means, is going to be about 24 hours of your life. And so another perspective is when you add the parenthood in there, look at all those days. The breastfeeding's still much bigger. The pregnancy's looking smaller, and still just a sliver, 24 hours, right, is your labor and birth process. So to me, that's the emphasis on that parenthood is so important, right? This is not just about your baby being born. Your kids also grow up way too quickly. So those are my twin boys, Zanskar and Teo. They graduated from Kalaheo in 2021. One is in his second year of college in Colorado, and the other one is finishing his first year of college in New Zealand. So I just want to remind you that every day with your kiddos needs to count, right? Because all of a sudden, that same feeling that you get when you bring your newborn home, right? There's that message out there that it's hard, postpartum is really hard. And when you bring that newborn into your house, there's a little bit of grief that may come. And that grief is for the life that you had before you had a baby. You knew yourself. Maybe you had a career or a job, or you just had a relationship with your partner that was rich, and now there's this baby, and now you're becoming parents, and you don't know who you are as parents. So when you are early in those postpartum days, there is a little bit of grief that's there for your life beforehand. So I like to warn you about that, because some people feel really guilty when they're having that feeling for how life was. And then you're going to learn how to be parents and how to have this baby in your life, and you'll eventually get to a spot where you're like, I can't even imagine how it was before. And then they graduate and go off to college, and that same feeling comes back, but it's the grief for your family life. And now the wonder is, who am I now that my kids are doing their adult things? I have adult children. So who am I now that I'm not a mom daily? So remember this little slide that they grow up way too fast. So make every moment count. Don't be in a rush. for them to go to the next phase of life. Sometimes that newborn phase, though, gets a little old, I'll tell you that. So at Kaiser Permanente, we're here for you. So this class is part of making sure that you have a satisfying and safe pregnancy and birth experience. And our whole team is going to go make every effort to meet your pregnancy, birth, and health needs. Okay, we are doing shared decision making, which is lovely, which means if you need an induction, for example, here are the options that are available based on your cervix. This is what we would recommend. What are your thoughts? What do you think would be best for you and your body? So having a baby with us, there's a lot of benefits to that. So one of the big benefits is that you're the center of care. I shared with you that I've worked in a lot of varieties of settings. And one of my favorites is how we work at Kaiser, where I am here as a midwife, the doctor is here as the physician. And so decisions are being made based on you, your body, and your family at the moment. So it's not that the nurses are, the physician or midwife is maybe in clinic and they're managing remotely and the nurse is managing at the bedside and then they call in the doctor at the last minute for the birth. You're not going to have that here at Kaiser because we're all here. And so we're not making a decision based on, well, I really want to go to my kid's, 5-year-old birthday party or whatever, right? You are the center of our care. We actively promote breastfeeding. Our breastfeeding rates are great and very high. Part of that's because we support the skin to skin. So when baby is born, baby goes right onto your chest and stays there. We delay the cord clamping, let baby really transition just right on your warm belly. And then that allows for breastfeeding to happen a little bit more quickly. We have 24-hour rooming in. So those movies where there's the window and people are pointing to their babies, that doesn't exist here. You saw the cot here in the room. The baby stays with you. We totally want your family, your partner to participate and be involved. And we will show you how to swaddle baby, put on diapers, and let you do as much as the care as possible. We have a dedicated team that's here. So the 3 providers are OBGYN attending, the midwife, and a resident. So the OBGYN attending has a big job. They're covering labor, the emergency room, our surgical patients, any mothers that might be admitted in pregnancy, and also postpartum moms. So that's a big job. The residents are not students. They are medical doctors fine-tuning mainly their surgical skills. They do learn a lot with us too, as working with the midwives and also from the nursing, being new to their careers, but they are doctors and not students. So they also cover the whole hospital that I described with the OBGYN. Midwives, our main focus are our labor rooms, our 9 labor rooms that we have. You'll be seeing most of the time, even if you are considered a more high-risk mom, you may see all of us in there, and that when it comes time to birth, if you're pushing out your baby, we can still be there with you to normalize that process. I have a whole slide on midwifery, so we'll talk about that too. Pediatrician, so the pediatrician that you see here in the hospital is going to be different than the one you see in the clinic. So they are here, they're called hospitalists. So they will round on your baby and we will make sure to get you scheduled for outpatient care with the pediatrician of your choice. Our lactation consultants are here 7 days a week, usually during the business hours, but all of our nurses, all of our postpartum nurses and our midwives, we're all trained to help you with breastfeeding. So most of the time we can help. It is an art. That is why I put on there the La Leche League information. It's just because it's about the art of breastfeeding. Some babies latch right away. Other babies, they need to learn. I usually blame the baby though if it doesn't latch, and give it a try if it doesn't work with the first one. But we have all kinds of tricks that we can help you with. Nurses, We have the maternal fetal medicine specialists too that are here and available to us if we have a high risk situation and need to call them in. We also have a full newborn intensive care unit called a NICU. That is for babies that need special needs. It's here on our 6th floor. It's just down the hallway. So our moms can very easily access their babies, and we get you there as soon as we can. You definitely need to be negative for COVID to go in there. So that test is important. And also the vaccines are important just to help protect the newborns if your baby goes there. So just an example, Queens can only do 34 weeks and above for births. And Castle is also, they don't have a NICU. Our hospital is unique also in that we have a complete intensive care unit if mama also needs that higher level of care. So both mom and baby would stay in our hospital and we would be able to meet the needs for that higher level of care under our roof. So one example of that is early on when people were getting quite ill with COVID, that we had babies that needed to be born very early and go to the newborn intensive care unit, and mamas that were in the ICU for the COVID care. So we're very fortunate to have such a high level of care that we can give with multiple different teams. So this is the picture form of how our care is. You are in the center and everybody's around you. So it's a collaborative practice. So we also have our nurse anesthetist. So in labor, your nurse, like Sunny, who's on chat right now, she's going to be with maybe 1 or 2 clients at a time. If you start to push or your labor is more complicated, then it's one-on-one nursing. I mentioned that the nurse midwife then is the next one that's there, and the OBGYN. So sometimes you'll have both midwife and OBGYN, sometimes just the midwife. And then everybody else is around you there giving you support. So this is a little bit more detailed video on midwifery. So let me just play that for you.
The first step to having a healthy baby is having a healthy pregnancy. At Kaiser Permanente, new moms have many great choices when it comes to prenatal care, labor and delivery preferences, and highly trained providers, including certified nurse midwives.
I didn't really know what a midwife was. And what I liked about it was it just felt very personal, and it felt like she was there kind of as more of like an emotional support person as well. I feel like during the prenatal process, she was there for me, of course, to answer anything that I was feeling throughout. And then she also got to know me, I felt like on more of a personal level too. So we kind of would chit chat about life as well. I had Connie and Linda as some of my midwives here at the hospital, and they were always coming in and just kind of telling us what exactly was happening. So they were very transparent, but then they were also reassuring and just would let us know what solutions we could go from depending on how the baby was reacting to everything.
The midwives do about 75% of the vaginal births here at Kaiser. We do about 120 to 140 births a month. So we do a lot of the deliveries. We actually take care of our lower risk moms who come in labor closer to their due date, and we support them in labor. We do the deliveries. We take care of them postpartum, and we see them back in the clinic 3 or 4 weeks post-delivery. And we love that, and our families love that too.
I would really recommend having a midwife during your pregnancy experience, just because they have the expertise that the doctor has, and then they just bring more of like a personal and emotional touch to it. They treat us like they didn't have any other patients. It felt like they really cared about us and we weren't just a number.
So what's really, I think, wonderful here at Kaiser and the way that we work so closely with our OBs is that our obstetrician gynecologists have a really good understanding of what midwifery is. And one of the differences that I use to explain between midwives and the OBs is that when you come into clinic to see me, I'm asking you to tell me how you are, right? To empower you to tune into your body and tell me what's happening with your body. Where OB's training is to tell you how you are when you come in, right? That they're going to look at lab values and tests, and you come in to find out how you are. So what's nice with how we work is that our OBs have an understanding of the midwifery. And so for somebody that is healthy and well, they can also treat the pregnancy as a low-tech pregnancy and healthy and well pregnancy. And then as midwives, for some of our more high-risk mamas, we can bring that normalcy in, but we also have the medical understanding of what's going on in the pregnancy too. And then in labor, sometimes babies come all at the same time. And so our OBs, even in a very normal labor experience, if they do the delivery, they'll come out and say, I was such a midwife in that room. And we'll say, what does that mean? And they say, I left the lights really dim. We didn't break the bed, right? The bed's just lowered. And we just let her push to her own rhythm. You know, it's beautiful, which I think sums up the midwifery and OB difference quite a bit, where our training is 2 years of normal and recognizing the physiological and supporting the normal birth, and also being ready for obstetrical emergencies, where the OBs have a very shorter span of the normal, and then they're focusing more on the surgery and the abnormal management. So it's a lovely blend between us here in the care that you get. So one of the benefits of this online class is learning amazing information about your own body, pregnancy, labor, and delivery. I already introduced the key players, right? The pelvis and your uterus and cervix. So we've got some of those words out. This class is also going to discuss options for handling pain. And we'll watch actual videos and you'll see different methods that are offered to help a woman through her contractions. And you'll learn about our family birth center, so you'll know what to expect. And when you are prepared and you're collecting this information, you're going to develop trust in your team. And that's the first thing that I want, is when you come into the door, just in this class, hopefully the message is, we got you, right? We're going to be there for you, and that you don't have to come in with a distrust. One of my favorite shows, and if you want to watch birth and realistic birth, it's called Call the Midwife. It's from the BBC, a British production. It's based on a book from a real midwife and her experiences in the 1950s of London. Historically, it's an amazing time where babies were born at home with nuns, and then the nurses became the midwives. So that was a shift, but still at home. And then the hospital setting came in, a more medicalized childbirth. So you really see a wonderful kind of historic picture of birth, recent history, right? Because birth is as old as time. And one of the episodes had this lovely quote about, we can only prepare, but we can't predict. So that's part of tonight is, let's say you are planning to come in and be 6 centimeters and your water breaks and push a baby out in 20 minutes. I want that for everybody, but sometimes it doesn't happen like that. So even though that is your idea, your wish, that you also prepare for what would an epidural look like, and at what point would I ask for an epidural or IV pain medication, just so that you're prepared, right? You can see both sides. When I gave birth to my twins, I went in, even though I wanted them to not go to the NICU, I still went in and did a tour so I would understand. And I had many conversations with my OBGYN about the likelihood of a cesarean and what that would look like for twins. So that's part of being prepared, because you can't predict what's going to happen in the moment. This is a beautiful time-lapse video. So There will be a newborn baby that's just born, but you don't actually see the birth in this video. I will warn you when we get to the videos where there's actual birth, because I want to respect that some people are not ready to see that. That's okay. This one is just a time lapse. It is a beautiful movie from one of our Kaiser families, so it is one of our rooms. You will see the familiar drive to get to our hospital, her going up into our elevator, so it's very familiar. And I just think this family has so much positive and joy just in what they captured in this video. So enjoy.
Happy days
You
are
want to push?
coming my
You can push
way.
me around.
Happy days are coming my way. Happy days are coming my way. Happy days are coming my way. Sorrow sang its funeral.
What a wonderful birthday present.
The morning comes.
Ellie Bear!
brings new.
You know what she did this morning?
She fell.
She tapped on my tummy and kissed it 3 times. What? Ellie?
Happy days are coming my way. Happy days are coming my way. Happy days are.
Big sister! Number 9! Shut up!
What? Are you guys? Here we are, we're on our way to the hospital. Trisha's been having pretty regular contractions. Ezra, smile. Bye, everyone. Seven pounds, 15 ounces. Is that what you expected, love?
Hey,
Intenso.
Intenso. She is my superhero. Happy days are here! Yay! Woo-hoo!
All right, so I want to push at the beginning is her first pregnancy. The baby was what's called breech. So we'll talk about cesareans, but sitting upright in her pelvis where the head is up towards her top. And so she had a C-section, planned, scheduled C-section for her first delivery. And then what you saw in the video was a trial of labor after a cesarean and then a successful vaginal birth after C-section. And I think that's just important to understand that with your first baby, if there's a C-section for whatever reason, we do support the vaginal birth. The door is not closed for a vaginal birth as long as the surgery goes well. And definitely our surgeons would tell you if there was concern for laboring after a C-section. So tonight, we're going to go through pregnancy resources. We're going to talk about your amazing bodies, discomforts in pregnancy, healthy eating and exercise, fetal movement. We're going to talk about warning signs and pre-labor signs. Then we get into the signs and phases of labor, coping techniques, options, labor support, cesarean delivery, and postpartum. It's a lot to cover in 3 hours. Historically, this class was 6 to 8 weeks, once a week. So we have condensed it and we're still doing it online. So it is not at all going to be your certificate and that now, you've got all the information, but hopefully I'm going to give you enough information and little slivers or breadcrumbs to say, I want to follow that trail. I want to look a little bit more at that. Okay. So pregnancy resources, the phone numbers, I highly recommend you put in your phone now, if you've got them right next to you. Labor and delivery, 808-432-8552. There will always be a human that answers that phone. And those of you that took the Welcome to Childbirth education class, you know about that number. That is always going to be our ward clerk usually, or one of the nurses that answers that phone. You will not get the press 1, press 3. So let that phone ring. There are 3 different lines that come into that. The lactation services, 432-8518. Those are available to you at no cost for the duration of your breastfeeding experience. So that's an important phone number to have also. KP Maternity, so I've left a link in the chat to that, and that is lots of great information. There are also videos from our other midwives about vitamins, about exercising. So if you are an adult learner that likes looking at videos, kp.org maternity has, it's almost like a community college course catalog, right, of just all the classes and the information that's available. You should have also gotten the ACOG book, that American College of Obstetrician and Gynecology book, and that book is also full of information. And the reason I'm tailoring you to the kp.org and the ACOG book is because everything that is posted online for kp.org and in that book has been well researched. The problem with Google is that you can get opinions and it can get very confusing. So please stick to those resources and the other ones that I give you tonight. So we do have the Welcome to Pregnancy Care with Kaiser class, which is best when you are earlier in your pregnancy because it goes through the care that we give you and then more importantly, the care that you do for yourself. So thank you to, there were quite a few of you that have taken that class also. Thank you. There's a class of newborn care, and that one is a PowerPoint presentation that's recorded. So that one is not live, but it is given by one of our very experienced postpartum nurses. There's also healthy pregnancy and meeting with health coaches that's available. And then my favorite website, and I've already mentioned it once, and I'll probably mention it several more times, is the spinningbabies.com. That's daily positioning, hip opening, weekly exercises to really get baby in a good position throughout your pregnancy so that birth can go a little bit more easily. There's also the blue folder that we gave you at the beginning of the pregnancy with the what to expect when having your baby with Kaiser. In the very middle of that book is, they call it a birth plan. I really like to avoid the idea of a plan. I like to call it birthday desires, birthday wishes, birth ideas. Do you understand why I'm saying that, right? Because this is not something we can necessarily plan. So, call it the birthday wishes, and then that way it's easier if baby creates a situation where a different pathway is needed. And then please bring questions to your next visit. We love questions, especially, I mean, we're seeing you weekly at 36 weeks. So those are the questions about labor and delivery. And we do have the what to pack list too. So, and it's in that what to expect booklet. So let's talk about your amazing body. So this is a baby that is perfectly aligned. The cervix is right underneath the baby's head, and you can see the vagina. There is this tilt, right? That baby has to drop into the vaginal floor and then turn a corner to come underneath the pelvic bone. And so what you have is the uterus. So your uterus is usually the size of your fist, and you can see how thin it gets toward the end of pregnancy. You can see baby sitting on your bladder and then also on your rectum, right? Look at how the spine is affected, how the spine is much more bowed and curved, right? And then we have the fetus or the baby, the umbilical cord, the placenta, the little toes, they're so cute. The amniotic sac, which I showed you when our little pretend baby was introduced. And then your cervix. And then the vagina is the opening. So those are all your parts, kind of from the side angle with a perfectly lined up baby. So the things in this picture that are going to influence your labor are your pelvis, the power, your passenger, and then your psyche. So that's one of the ways that they teach it to us in midwifery school, or also nursing, obstetrical nursing, or our OBGYNs. So the pelvis is your bones, and that's what you're born with. And we will say that you are proven to 7 pounds, 15 ounces, like the woman in the video, right? Once baby passes through that pelvis, you are proven to that weight of the baby. So we don't know what your pelvis is going to do. Spinning babies is going to help so that pelvis can open either up top to allow baby to come through, or down below to allow baby to drop into the pelvic floor. The power are the contractions, and that's from your uterus, and those contractions. Oxytocin is the natural hormone that's being used, and it's actually squeezing the uterus, but it's also pulling up that cervix, right? So the cervix is not just opening, but it's also shortening. So the power we can influence, so we can give the synthetic form of oxytocin, which is called Pitocin. And we have a lot of respect for Pitocin here. Takes about 20 minutes for it to work on the receptors of the uterus. It goes through your IV. And so you will not see Sunny or any of the other nurses increasing that Pitocin any more frequently than 20 to 40 minutes, 30 minutes, just to allow for it to take time. If your own labor kicks in and we turn it off, it takes 5 minutes to clear it out of the system. So we can help the uterus have a little bit more power. Your passenger, you can help that passenger, the baby, find a good position with the spinning babies techniques, the exercises, being up and moving, mobile for as long as possible. And then if you choose to have an epidural, we will help you find positions that are better to help the baby descend into your pelvis also. But I tell you, if labor is held up, it's usually that little passenger that's doing it, right? Because that range of motion, even if you're head is tilted just to the side. Like if everybody does that right now and you try to tip your head back, you can't. But when your chin is in the middle, you can really tip your head back, right? Like nodding yes. But if you're going backwards, there's not a lot chin drop to your chest. There's not a lot of room that way. So that's that range of motion that you need. And then the psyche is your environment. If anybody has ever seen a dog or a cat give birth, they actually will stop their labors if you enter the room and pause to make sure that they're safe. And so you need a safe environment. When I mentioned wearing your own clothes, that's part of it, right? Feeling yourself, right? If you are somebody like for me, keeping my nose ring in during my whole labor was important to me, wearing my jewelry, wearing my own clothes. Having creature comforts around you, like the smell of home in a blanket or your own pillow, the lights being kept low. And when I talked about our OBGYN coming and doing a delivery and saying they were like a midwife, and what that meant is that the lights were low and they used soft voices, right? That's usually what women need when they're in labor. When they get to more advanced labor and they start to kind of lash out, we reassure partners that that's a really good thing. So we'll go through the stages of labor, but there's your anatomy on the inside. And then externally, this is your amazing anatomy. That is the door for baby to come out, right? So we talk a lot about the cervix dilating and being gone or 10 centimeters, but look at the vaginal opening. That also has to allow for a baby to pass through there. So that happens in a lot less time. Your cervical dilation, right? We talked about the 24 hours, right? But when you're pushing, it's going to be probably maximum of 4 hours and that baby being at the door of the vagina is even less than that. So there is some perineal massage that you can do. There's a device called the Epino, and we'll talk about that, just to help stretch that area to allow for baby to emerge and less tears. You have your clitoris that's up at the very top, and the clitoris has just finally been mapped in the year 2005, and that runs pretty much along the anterior wall inside the vagina. Below the clitoris is the urethra. The thinner lips are the labia minora, and then the lips that have the hair on them are the labia majora, or the larger labia. There is no recommendation for pubic hair in labor, so please, whatever you're doing is fine. There is no medical reason to shave or to wax. That is not anything that you're doing for us. So again, pubic hair fashion is up to you. But if you are somebody who gets irritated, then definitely don't worry about waxing or shaving or doing hair removal of any sort, okay? It's natural to have hair in the pubic area. So your uterus is inside, the vagina is the opening outside, your urethra is the opening for your bladder, and then obviously your breasts are involved also. So looking at those images, you can imagine why there are pregnancy discomforts. So as your body changes in weight, your breasts get larger, you start to feel tired, you get that carpal tunnel feeling, that numbness or weakness in your hands, just as you expand and make more fluid in your body. You actually double the amount of blood that you have in your body when you're pregnant. It is amazing. You might have heartburn, right? Think back to that picture and the baby being right underneath your rib cage and right up against your tummy. Hemorrhoids as babies pressing onto the rectum. Hemorrhoids are varicose veins in the rectal area. Sometimes they can be painful, swollen, sometimes they can bleed or hurt or itch. So please don't feel embarrassed. If you do have some hemorrhoids, come in and talk to us about that, okay? They're common in pregnancy. A belly band can usually help with that. You also might get leg cramps. That's a sign that you might need more magnesium. I think the common wives' tale is eat more bananas, right? But the leg cramps can be really impressive. And if it's red or tender, after the cramp goes away, you definitely want us to have a look at that and make sure it's not a blood clot. But the leg cramps, the best thing is to just get your toes towards your nose, have somebody rub it, and then add some extra magnesium. Those lovely nighttime supplements like the Calm, those are good. That have the magnesium, the little drinks that you can make. And then morning sickness, as most of you know, it's not just morning, it's all day sickness. And for some, it lasts all the way through pregnancy. So all those discomforts, you might be short of breath. Your pelvis might ache. I mean, I put the picture back in there because you can imagine why your hips start to hurt, right? Everything's opening to allow for baby to drop into your pelvis, which leads to sleep problems, stretch marks, itchiness of the skin, frequent urination. Look at baby on your bladder. Varicose veins in the legs, not just the rectum, the hemorrhoids, and then Braxton Hicks contractions. So Braxton Hicks contractions are a tightening of the uterus. Some people describe it as I could see how the baby was laying in there, right? Because the uterus is just all constricted onto itself. And so the difference between a Braxton Hicks is that they kind of hold on for a lot longer, so maybe 2 minutes. And it's an external feeling. Generally, you're not going to feel it inside. It's going to be tight on your tummy. Braxton Hicks contractions, I think, are a guide for you. And when I say tuning into your body, the Braxton Hicks contraction gets you to tune into your body, because most of the time when it's balled up like that, it does make you stop and then go through the little checklist. Do you need to go pee? Is your bladder too full? Because just like when your bladder floats, right, it'll irritate, if it's really full, irritate the uterus and cause it to constrict. Or is your bladder empty and you need to drink a lot more water, so a little dehydrated can also give you that Braxton Hicks contraction. Do you need to eat something? Are you hungry? Did you just eat something and you're really, really full? Have you been sitting down and lethargic for a while? Do you need to get up and move? Or have you been too busy and now you need to rest, right? So go through that little checklist for your body. And then if there's nothing that you can really tune into that your body needs, then it's just a Braxton Hicks contraction. If it was a more preterm labor contraction, it's going to feel more like a menstrual cramp and really hurt a little bit more. So the hormones that are involved, you've got your dopamine, your endorphins, serotonin, and oxytocin. So the dopamine is your reward center. The endorphins are the ones that help with pain. And serotonin, your mood feels better, right? And the oxytocin is that love hormone. So when you're packing, some of the things that I showed you in this room, bringing your own snacks, right? Getting in the bath or the shower, exercising, so getting up and moving, dancing, playing your music, laughing, those things can help you cope with the labor a little bit more. And then with the oxytocin, if you watch the video, the animated video that I put in the chat or that Sunny did, you'll see oxytocin is these pink waves coming out of the woman, and you'll see them kind of increase with touch when she's in a very safe, dark spot. When there's music playing, you'll see the waves of the oxytocin going more. And then, of course, when the baby latches to the breast, that oxytocin is released as well. And then the serotonin, so just nature. So our hospital windows don't open, but most of our rooms have beautiful views. So spending some time looking outside or bringing in your laptop so you can kind of play beautiful images of places that you've been. So exercise and healthy eating are going to help you have an easier birth, right? You would never sign up for the marathon, put on 70 pounds, and then try to run it. And it's not preparation for you know, the birth that's going to be your recovery postpartum. The recovery is from being pregnant too. So it really does matter what you do now in your pregnancy. So moderate exercise helps you feel your best, right? Check with your practitioner if you're going to start something new. So most of the time, swimming, walking, those are going to be fine. Avoid getting dehydrated, so drink extra water. That liquid IV that I showed you, those packets, whatever exercise you choose, don't overdo it. So if you're walking with a girlfriend, you should be able to keep a conversation going. It shouldn't be, you know, gasping for air. Swimming, stretching, yoga, prenatal yoga, low impact dance or aerobics, those are all really good things. And then Kegel exercises. I have a separate slide for that. That's where you pull your pelvic muscle in and hold and then release. And it can be done anytime, any place. No one can tell when you're doing a Kegel exercise. And the more you practice now, the easier after those muscles have been through a birth, it'll be to get those muscles back in shape. And while you're breastfeeding is a wonderful time to do a Kegel exercise. So at postpartum, you're going to start exercising 6 to 8 weeks after baby. So that's just to allow your body to recover from the pregnancy too, right? And then your goal will be to lose the pregnancy weight. So important, because if you start your next pregnancy 10 pounds overweight and then gain, and then the next one 20 pounds overweight and then gain, you can see how we set ourselves up for more complicated pregnancies, but also harder to recover and harder to birth. And then again, this spinningbabies.com, make sure you check that out. So Kegel exercise is moving the vaginal pelvic floor. So you're trying to isolate these muscles that are right under the urethra and just above the rectum. Sometimes the perineum will actually move. So during pregnancy and delivery, as the pelvic floor becomes stretched and weakened, it can cause urine to not be as well controlled afterwards for months or years after childbirth. So getting your core to your tummy muscles back in shape is important also on your bladder. And start doing exercises, Kegel exercise during pregnancy, and then continue them after with baby. So the perineal massage is usually, if it's on yourself, to the thumbs, both of your thumbs, pressure down towards your rectum, and then a little bit to that 4 o'clock and 8 o'clock, like the, you know, the clitoris is at 12, right? The 4 and the 8 kind of down and out. And just like any yoga pose, you'll feel a stretch and maybe a little burn, and just breathe into it and see if you can stretch a little farther. It should not cause you pain, okay? The device called EpiNo is a little dilation device that you pump some air into it and it'll dilate if you're not comfortable. And I get it, it's hard to do when you got a belly in front of you too. But that is not on Amazon. You have to get it from their website. It's Germany has had the dilation devices available for a long time, and now they're available for us. So nutrition, it does matter. What you eat now is going to influence the amount of weight that you gain, the nutrition that the baby's getting, and babies learning different tastes already because they're swallowing the amniotic fluid, and that's influenced by what you're eating. And so, you know, if you think about that with different cultures, you know, how babies in India are habituated more towards the curries, right? Or if you're in China, different sauces and things and spice levels. And that's why, because that amniotic fluid is really influenced. And so if you are high fat diet, the pizzas and maybe takeaway burgers or French fries, that amniotic fluid is going to have those tastes. But if you're doing lots of fresh fruits and vegetables that are well washed, you're going to habituate your baby for that. And you're actually going to feel better too. So that is one of the best things you can do, is just the nutrition for you and your baby. You only need 200 extra calories a day for pregnancy. When you are breastfeeding, you actually need 500, so it's a lot. So 200 calories is like a cup of yogurt, or a banana and peanut butter, maybe some hummus and some carrots. So it's not actually a lot. And some people actually, if you start off a little higher BMI and you actually change the way you eat, more fresh products, you may end up losing some weight just from how you've changed. So pregnancy is not a time to diet, but it is a time to change how we eat and to make that goal for really healthy foods. Colorful plate, so eat the rainbow. Make sure you've got some protein, meat, eggs, dairy, tofu, beans. Veggies and fruit should be half of your plate. And then the carbohydrates should be the smallest. So that's your rice, your pastas. So we'll talk a little bit about fetal movement. So how active is your baby? Most of you are more than 28 weeks, so you can do active counting of baby if you need some reassurance. So babies will sleep about 20 to 45 minutes, so just be aware of that. And movements are going to change as the baby gets bigger. So for me, I remember that it felt like a fish in my bladder early on, and then it was like popcorn, and then toward the end, it was just these rolls and waves. Keep in mind, I had two in there, right? So I could feel the distinguished difference between the two of them and how they were moving. So tuning into your baby's movement also is going to give you a little insight into their little personalities, right? So at 28 weeks, third trimester, the movement becomes more like a pattern and more regular. So if baby's got a particular time during the day that they're really busy and they're not giving you that, you may want to just check in and do a fetal movement count. Counting all movements, so turns, hiccups, twists, jabs, rolls, those all count. So sometimes you'll hear it kick counts, but it's actually all movement counts, even hiccups, right? When the baby gets those little jumpy hiccups. Active baby is one that we're actually not worried about. So some people say, oh, I'm worried he moves too much or she moves too much. Generally, we're not worried if they're moving a lot. So to be able to count, what you need to do is have an empty bladder and lie on your side. Left side is usually the best, and look at the clock and write down the time and pay attention to your baby's movements, any movement that you feel. And you could just do like a little tick mark or something. When you've counted to 10 movements, look at the clock. And baby should be about 4 times in an hour or 10 times in a 2-hour period. So if baby's moving less, call labor and delivery, and you're after the 28-week mark, 432-8552. That is a number that's 24/7. And anytime you're concerned, so are we. So please don't feel that you're bothering us if you call that number. Okay, so warning signs. Preterm labor is less than 37 weeks of labor. If you're at that 36-week mark, though, we're not going to stop labor, but we're also not going to encourage it. If you come in and maybe your cervix is making some change, we're not going to increase. The last couple of weeks, baby's learning to actually breathe. They do these little practice breathing and their lungs are maturing and they're learning to suck too. So babies born that 39 to 40 weeks, they actually breastfeed a lot better too. So again, any of these things you're going to call labor and delivery. So vaginal bleeding. So it is normal to have like a little browny mucousy discharge maybe after intercourse, or when you're at that 36-week mark as the matrix of your cervix starts to kind of break apart, you might have some brownish discharge. But if it's bright red like a period, you need to call us. If you end up with a fever that's 100.4, definitely call for that. Take some Tylenol. That's where we'd probably want you to come in and be tested for flu or RSV. Whenever you have a fever, your heart rate goes up, so babies can increase too. If you've got pain or burning with urination, like a bladder infection, we'd want to know about that. If you have sudden swelling of your hands and face, problems with your vision, recurrent headaches, especially after 28 weeks, that's preeclampsia signs. And so we really want to look at that. That is a illness in pregnancy that we don't know why it happens, but women can get quite sick and it can lead to seizures of the mother. So That's why we see you more often after 28 weeks. We're seeing you every 2 weeks to make sure your blood pressure is okay, check on your swelling, and ask about headaches or just anything else that you're noticing. Vomiting and diarrhea, if you can't keep anything in, you'd probably want to call us to get some IV therapy and again, check for flu. Major changes in your baby's movement, as we discussed, and anything that doesn't feel right, we're here for you, right? So preterm labor can be pretty vague. It might be like we talked about menstrual cramps when we talked about the Braxton Hicks. So Braxton Hicks is just a kind of external tightening. If you're getting menstrual-like cramps or a low backache, if you're somebody who gets your period signs in your back, that would be something to let us know about, especially if it's coming and going. So if you've got every 10 minutes or less than 60 minutes, we'd want to know about that. If you've got a low, dull backache or maybe some pelvic pressure or pain, sometimes when women are going into labor, they'll clean out their bowels. If you've got an increase to your vaginal discharge, mucusy is normal. That cervical mucus can look like meat fat. It can be impressive, but if there's just a shift and you're still earlier than 37 weeks, I'd want to know about that. Or if your bag of water opens. So generally that's a big gush, or it will have a very different smell than urine if you're noticing your undies are very wet. Put them, if you are coming in to see us and you've had a big gush, put either your undies or your pad in a Ziploc bag. We do want to see that, so bring it in. Okay, here we are, an hour and 15 minutes into this, and we're talking about labor, finally, right? All of that other stuff, though, is so important to know about your body. So labor, regular contractions that cause cervical change, and contractions help your cervix to thin out, dilate, open up to 10 centimeters. So the average length of first stage of labor is 12 to 13 hours for your first baby and shorter for your second baby. And the stages of labor has 3 parts. And since we're all adult learners, I'm going to go through this in a lot of different ways. So don't feel, if you're taking notes, that you have to just write everything down now. We're going to go through it in a lot of different ways. So early labor takes the longest. It's usually 2/3 of the total labor time. Usually you can maintain moderate activity, you're excited. Active labor contractions are increasingly consuming and challenging. I like that description, which means you usually can't walk or talk through them anymore. And your cervix dilates to that 6 to 8 centimeters. Transition is the horrible, nasty bit, the most uncomfortable and intense part of labor. The cervix is opening to its fullest, so 8 to 10 centimeters. So once again, we're going to go through those in many different forms. So here's the table form. So we have the stages of labor, what the cervix is doing, contractions, what your emotions might be, and the timing. Okay, so first stage, early labor, the cervix is dilating 0 to 6 centimeters. The contractions are usually irregular and mild, and you might be really excited. Hey, I'm having contractions, because you're at that finish line and you're ready to have a baby, right? You might be talking and exciting, and we really don't know how long that takes. So historically, we used to start labor at 3 centimeters. That was based on some research that was done in the 1950s. And thank goodness, when they started to look at the rising cesarean rates around the world, they realized that 6 centimeters was a better active start to labor than 3. So now it's 6 centimeters. So first stage of active labor, your cervix is going to go from 6 to 8 centimeters. The contractions now are really, they're regular. It's almost like our bodies have a clock. It's so incredible. So they're every 2 to 5 minutes. And now you're going to be more serious and real quiet with the contractions. You still might be able to listen, but you usually won't answer until after the contraction's done. And that's going to be about 8 to 10 hours. So now we're getting into that 24-hour time, right? Transition from 8 to 10 centimeters, regular, every 2 to 3 minutes with your contractions. And this is when people are in the zone. And in our videos, you're going to see when people hit this spot. I have a couple of videos that are unmedicated mamas and some that have some medication. This is where things are just washing over your body. It's usually the shortest. If you are unmedicated, it's 2 to 4 hours. Everything can be a little longer with the epidural when we kind of relax you a lot, but it still can stick. Sometimes things speed up, sometimes they slow down. Pushing is when your cervix is 10 centimeters, and that's with crowning and your vagina is opening up too, right? Contractions space out a little bit if you are unmedicated and not being induced. You have a natural pause, and that's because now you're doing something very active and physical, and then you're usually concentrating and you're actively involved in this part. So you can push from anywhere from 1 to 5 hours. Our videos tonight are really sweet. These first time mamas are like 15 or 20 minutes, but just keep in mind that it could be a couple hours of pushing. And then the third stage is what is considered the delivery of the placenta. So that is where we are controlling bleeding and we're doing your repair. Your uterus is still going to have contractions to get the uterus to shrink down. The emotions are usually joy, celebration. That first video that we watched with the time lapse, did you see just that? Like she almost looked naturally drugged, right? Her face, so there's just this relief and this incredible like joy and awe about what just happened. And generally it's going to be 20 to 60 minutes after birth. So now for adult learners, I'm going to go through these and give you signs. I'm going to role act about what stages would sound like, okay? And I'll start the role playing. We're going to pretend that I'm calling in to talk to a nurse about should I come in or not, okay? So first stage, early labor, the woman calls. And maybe Sunny's going to be our nurse that answers, right? So Sunny says, labor and delivery. This is Sunny. Hi, Sunny, this is Jen. And I'm having some contractions. They started about an hour ago. And oh my gosh, there's one. Oh, they just keep coming. It's right now. My tummy's so tight. What do you think? Should I make my way back in? And Sunny says, has your water broken? And the woman says, no. I haven't seen anything like that. Is the baby moving? Oh yeah, baby's moving a lot. In fact, I can feel baby right now, even during that contraction. And then Sunny's probably going to tell the woman to take a little bit of time, right? I don't think it's time right now. Drink some water, try to rest, or maybe get up and go for a walk, and just try to ignore it as much as you can, okay? So active labor, so same person's gonna call. Labor and delivery, this is Sunny. Hi, Sunny. This is Jen again. I'm calling. I know it's been about 12 hours since I talked to you last, but hold on. Oh. 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 Oh, sorry. I just can't talk through them anymore. And you know what Sunny's going to say? Jen, why don't you come on in? That sounds like you're in active labor. Let's have you come in so we can check your cervix. Okay? So that, if you're wondering, how do we know when to get people here? It's for things like that. So transition is going to be a little bit more intense. And generally what's going to happen is Sunny's going to answer the phone. Hello, this is Sunny. Sunny, this is Bob. I'm Jen's partner. And can you hear her in the background? Oh! Oh! And Sunny's going to say, well, yes, Bob, I can hear. That sounds really intense. and she won't even talk to me out. I don't know what to do. She won't talk to me even in between. She's just quiet and closing her eyes. She's probably transitioning. So bring her in, Bob. Bring her in right away. Park at the roundabout, and if you need to, we can come down and meet you. Okay, so just as a side note, the roundabout in front of the hospital has 2 spots that are stork parking. So if you're transitioning and your partner's making that loud sound and quiet in between and can't talk to you, get her a wheelchair to get her upstairs. Okay, that's usually the time that you'll need. Pushing, you're already here, so no more calling Sunny on the phone. If you're pushing on the phone, we're gonna have you call an ambulance. But pushing has a very distinct sound too. So then there's that deep moan, oh, oh, and then it becomes a grunt. Uh-oh, I got coffee on that one. So it's going to be an actual, you're going to hear the push. And again, that's when you're unmedicated, okay? You're going to be actively involved in that and concentrating, and you might be really just so excited that you're no longer so passive, right? And then third stage, the excitement is what goes, that's the sounds that are made during that time. And sometimes just quietly smelling baby, counting fingers, looking at ears, and establishing breastfeeding. So there we go. And we're going to still look at pictures now of early, active, and transition. So this is looking at the cervix, right? So the cervix, you can see the pelvis, and you can see the cervix. So everybody does a thumbs up right now. Just put your thumb up in front of you. So that is a long cervix. Your thumb is long. And now if you extend your hand open, so there's that 90-degree angle between your thumb and your pointer finger. Look at the skin in between your thumb and your pointer finger. That is effaced. So if your cervix is the size of a thumb, we say 0 effaced, probably going to be really firm, like in the picture on the far left. And then when it thins out, like in transition, the picture on the far right, you can see it's almost like just that little layer of skin, right? So that's what the cervix is looking with when it's changing the effacement. And you can see that it's opening up too. And baby's moving lower into the pelvis. So here's dilation. So I love it. It looks like a donut, doesn't it, on the left side, the undilated cervix. So it just feels like a little dimple in there. So if you purse your lips together, you know that when your mouth is closed and you're a kissy face, your cervix is, that's what it feels like, but a little firmer. And then when it dilates, we don't feel it anymore. We say 10 centimeters, but it's actually, we can't feel it anymore. And this is station. So when I said baby was moving lower into the pelvis, if you, everybody right now, sit on your hands, maybe palms up so you can feel better. When you sit on your hands and you wiggle back side to side, you can feel your sits bones. And that's the smallest part for baby to come through in your pelvis. And so, you know, there's different, like if you open your knees or close your knees, you can feel those bones kind of moving in and out. And that station is getting baby to drop into your pelvis. So sometimes you need to open the top of your pelvis, and sometimes you need to open the bottom of your pelvis. So when you're sitting on your hands, you can feel those bones moving. And then effacement, again, not effaced, long cervix, effaced, the very thin. And then this is the actual birth of the baby from the side view. So there's the picture of that extension, right? Baby's head has to stay tucked, come under the bone, and then they have to extend their head to come on out. And then they twist and their little shoulders come around underneath the bone too. And then baby goes right on your tummy for skin to skin. And then the placenta comes out. So delivering the placenta, you do usually have to push just a little bit. And then after the placenta comes out, you can see that there's a considerable area that is like a little suction cup, right, on the lining of the uterus. And so the uterus needs to put pressure on itself so that all those little blood vessels that were right there at the surface, you can control the bleeding that way. And then you start to shed the really healthy lining of your uterus. So sometimes you can have practice labor. In some references, you'll see it called false labor. But again, for me, language is really important in how we talk to our families and the pregnant person. And when you say false labor, it sounds like a lie, right? But it's actually not false labor, but it's practice labor, right? And then there's the real labor. So in practice labor, the contractions are usually irregular and they don't get closer together. So like in the first scenario between Sunny and Jen on the telephone, if Jen went to lay down, they might go away. Or she went for a walk, they might just kind of stay the same. But in true labor, they're going to get more intense, and they're going to progress and get closer together. When you move, they might stop and practice labor, where in true labor, they just keep going, which is what you want, right? You got to have all those positive affirmations for yourself. Yes, I want this. And then the strength of them, usually with practice labor. So you can have practice labor if you've had intercourse, because remember, an orgasm is a spasm of your uterus, and your uterus now is nice and big and out of your pelvis. And so you may get some irregular contractions after you have sex, which would be practice labor. So how strong they are is going to tell you, oh, this is just my uterus practicing. And then you do the same checklist like you do with Braxton Hicks. Drink some water, lay down, get up and walk, see what helps. Have a snack. If it's true labor, they're going to be strong and they're going to continue to get stronger. So to the point where you can't walk or talk through them. And then feeling the pain sensation, generally with practice labor, it's going to be just kind of toward the front, where true labor, you just get this big squeeze. So labor tips as we watch some of the videos tonight, just watching for the environment, watching how they breathe. You'll see some imagery and visualization. You'll watch them use water, so either the tub or the shower. Again, we have 2 labor tubs that are available to you, and we're using water for labor, but not water birth, so not having the babies in the water. You'll want to keep active. Warm or cool compresses and gentle touch or massage. We talked about the tennis ball, and generally approaching the massage with a caring and understanding approach, right? During a contraction, it might feel better to just have pressure, and then the massage can be in between, and we'll work with you and your support people. And you can watch in the videos. Music, I think, is so powerful because it's also a distractor. And it can trigger memories from other times in your life. Aromatherapy, or the smell of home from a blanket or a pillow, and then again wearing your own clothes. So this is Ty's birth. So watch this birth. You will see the actual birth of this baby. So for those of you, maybe you just want to hear the sound if you don't want to watch the birth. But it is a beautiful birth, and she doesn't push very long. So, and it's her first baby. So enjoy.
My name is Ty. I'm 24 years old. I'm 38 and a half weeks pregnant, and I'm very excited. This is my first child.
And I'm Brian. This will be my second child. I'm 25 years old, and I'm very excited to have our baby.
To ensure that I'm in good condition for labor, good physical condition, my husband and I have been taking a lot of walks. I also stretch on my birth ball, and I do a lot of exercising of my hips. It gets a little overwhelming sometimes, the excitement. Because we've tried for so long, and we just really want her here.
The anticipation is just, it's amazing that I'm gonna have my little baby girl with me.
My labor began about 9:00 p.m. I was on the couch and we were watching a movie and I had a really strong contraction, so I went up and I went to the restroom and it went for a little while, but I came back out and sat on my birthing ball, and about 3 bounces later my water broke.
Ty arrives at the hospital soon after her water breaks, as instructed by her doctor.
In the beginning, I was really calm and really relaxed because I was just so relieved that it was almost over, and that she was going to be here.
At the beginning of labor, my emotions were more keeping her calm, keeping her collected, making sure that we were doing the things that we needed to do, and just keeping her relaxed as we could be.
My support team during labor was my husband Brian and my sister Lena.
It was helpful to have Ty's sister so that I could relax when I had gone to my extent of helping. I was getting pretty tired, so she'd step in and help for a while. So it was really nice having the other support person there.
Probably around 11:30, they started getting stronger. And they checked me and I was only about 2 centimeters and 50% of face, which is what I had been since 37 weeks. The tub was really helpful because, you know, my skin felt really warm, so having the warm water against it really helped to relax me and helped my muscles to not feel so much pressure.
I decided to get in the tub with my wife to help keep her relaxed and calm and see if I could maybe give her a back massage. Just be a part of the labor.
The positions I liked the best, I really liked being on my birthing ball. Walking during my contractions and then just grabbing Brian whenever during a contraction and holding on to him and having him put counter pressure on my hips. Those were probably it felt most productive and got me through it the most.
We're gonna have this baby. We're gonna have this baby.
At about 1 o'clock, they had started getting really strong. I did a lot of just deep slow breathing, because I think that for me, that really helped to kind of remind me to, you know, take the pain in and push it out at the same time.
Oh, here comes a good one.
During active labor, my contractions were really strong. They were really painful. It was really, really strong in my back. Everything I did, it was like I couldn't get the pressure off of my spine. It was really intense, and I was so tired, it almost overtook me. Finally, at about 5 o'clock, things had really started changing. I started having more contractions. They were stronger, they were longer, and I had them check me. And I was 3 centimeters and 90% of face. So I had not gotten very far. For what it felt like to me, I hadn't really progressed very far. I was getting really discouraged because I was so tired and in so much pain that I just felt like my body was becoming useless. And that's when I kind of turned to Brian and was like, well, should I take something to kind of just get me to kind of take the edge off to relax? And that's when we decided to figure out what our options were other than the epidural.
Ty requests an analgesic for pain relief, which is a narcotic medication that dulls the sensation of pain. The analgesic is given by injection.
And we're done.
You're doing awesome.
We're done.
I just felt completely relaxed, and I actually was able to close my eyes and not have to talk and not be so emotional during the whole thing, and that was the most relieving part of it.
With the relief from the analgesic, Ty is able to rest for several hours.
I just felt just kind of out of it, and when the effects started wearing off, I was more alert, more aware of what was going on. At the very end, right before she had checked me, I remember feeling a lot of pressure.
Resting seems to have helped Ty's labor progress, and by 9 a.m. she is fully dilated and feels a strong urge to push.
I could probably push. Getting another one? Okay, let's grab those legs back.
Like, I felt her engage with my very first push, and that was when they told me that her head was there and they could see her hair with my first push.
Push all the way to your bottom. Feel that pressure down there. That's it. Come on, Ty. Keep going. Keep going. All right, catch your breath.
Everything happened really fast, so I really only pushed in one position.
Push through it. That's it, baby. Push through it. 2, 3. You can. You can. You're awesome. You can do it. Push. 8.
The baby's head crowns after about 15 minutes of pushing.
We had Ty stop pushing for a second so the doctor could suction out the mouth of the baby.
Go on this side of Ty. Go on the other side. Go over here.
And then I moved positions and I brought the baby up on the chest and I.
Hi, I hear you. Yes, I do. 9:50.
Right after she was born, Brian had brought her right up to my chest, and her nurse came up and we wiped her down, and she was wide awake. She was looking at us. There's a lot of things going on in my mind right after I had her, and it was, wow, I'm glad she's here, and wow, I'm glad I'm not pregnant anymore.
I can't believe you're here. Thank you for coming. Oh.
Just relief, tired, and just, it was amazing.
Yeah.
I felt the instant bond with Lily right away.
I'm really glad that we had done skin to skin and that she was right there immediately and that she didn't have to leave me for any reason.
Bravo. Good job. Yeah. Okay, still have track open.
Just having her here, it's really an awesome experience.
I've wanted a girl for quite a while now, and it was nice to finally see her.
Love for your new baby, it's just really, it's overpowering. You feel like you could do anything, with that kind of love.
All right, so in that video, what she got was the equivalent of what we give is morphine injection. It goes into the muscle and it lasts usually about 4 hours, and it will just give you this incredible sleepiness. So sometimes that's a nice option instead of an epidural, right? Just to do the morphine. We mix ours with Phenergan so that you don't have such nausea, but it really does. So anything that you get in the muscle is going to last a little bit longer. In some of the other videos, you'll see them get something through their IV, and that is fentanyl is what we use. So pre-labor, possible changes. You might have your bag of water open, usually a big gush of fluid, a steady trickle. Call us and let us know the time and the color of the fluid. And at this point, we are having you come in for evaluation. And then if it is confirmed that the bag of water is opened, we'll have you stay with us. We don't necessarily right away start to augment or get your labor going. We may give it a couple hours. Some people decide they want us to get the labor going sooner rather than later, so more like an induction process. You could also have the loss of your mucus plug, so that can happen a couple weeks before you go into labor, and that's the one that's more like a meat, fat, or mucus. I haven't come up with any really non gruesome way to describe it, but it is pretty impressive if your mucus plug comes out. No need to send us a picture. We've had a couple of them, but you don't need to. If you are concerned, call labor and delivery and describe what you're seeing. And then sometimes the baby drops into your pelvis. That's called lightning. And you'll feel it more. She said in her labor, she felt the baby engage right with that first push. So some people in the pregnancy will feel that baby drop down lower into the pelvis. So usually early labor, the contractions are going to be irregular. So when she took the medication, remember she was 3 centimeters, so she was still in early labor. So that really gave her a rest. And I loved how she described too, like, I was so disappointed. She was happy about the 90% effaced, but oh, I'm only 3 centimeters. So early labor, usually the contractions are irregular, maybe 30 seconds to 2 minutes long. It could be days. So just be prepared and try to ignore them and try to sleep. So you could do a unisom, the chamomile and lavender tea, those things. And keep in mind, if you lose sleep, you're not going to cope as well also. Sometimes if your labor, the early labor is lasting that 7-day mark, it's again usually because baby's not in a good position. And so that spinning babies again can help with that. Usually you're still pretty modest. You might have some clean out of your bowels happening. You might have some mucousy discharge, sometimes blood tinged. And it's really a time to take really good care of yourself, drink lots of water and eat light meals, right? And when you're planning to go to labor and delivery, it's the 5-1-1 rule. So contractions that are every 5 minutes apart. So you time it from the beginning of one to the beginning of the next. That's lasting for a minute. So from the beginning of the contraction to the end, that's going on for an hour and you can't walk or talk through those. Then it's time to come on in. Active labor, your cervix dilates at 6 to 8 centimeters, usually 3 to 10 hours. They're going to be regular, painful contractions, usually 3 to 5 minutes apart. This is a really good time to come into the hospital. It's a great time if you are planning an epidural to get an epidural. Usually you're not hungry at this point because the priority of your body is not to evacuate your digestion, right? So anything you would eat kind of stays in your tummy. So usually you're not hungry, but it is important to continue to drink water. And then the bag of water might be broken or opened by us, or it might break on its own. You may have, again, the mucus discharge and blood tinge, and it's time to really listen to your body and just that confidence that your body actually knows what to do. And then active labor tips as the contractions get stronger, your need for your support people also increases. Frequent changes in position help you stay comfortable and helps the labor process just continue. Again, the spinning babies, change positions frequently, back massage, the tennis ball, or even leaning into the wall. Verbal coaching is helpful. And your labor environment becomes even more important. So choosing your music, dimming the lights. And then the horrible, nasty bit, right? If this is the worst ever, it can't get worse, right? So it plateaus, the pain plateaus at that 8 to 10 centimeter mark. Very strong contractions. It's usually shortest, 1 to 2 hours. Again, if you're unmedicated, a little longer, it can be when you have an epidural. Lots of mucus discharge, usually blood tinged. You may be peeing frequently. You may need to sit on the toilet because you have an urge just to have a bowel movement or push down. If you have an epidural, usually you're going to feel that pressure as baby comes down too. And then the labor partner should provide undivided attention at this time and encouragement and support. So it's not time to be on the sleeping bed trying to get some rest. It's time to actually be there right at the support. You'll see in some of the videos the hip squeeze. That's a really good thing to do during transition because when you hip squeeze, you're squeezing the top of the pelvis so that the bottom can open up. And when you push, the cervix is completely dilated, it's all the way open. And then this stage ends with the birth of your baby. It usually lasts about 1 to 4 hours. This is the stage where Sunny or our other nurses would be one-on-one with you. Most of the time as a midwife, I'm in there too, unless I have other people out and about that I need to go check on. But we'll all be pushing with you. Contractions push the baby down the birth canal, and then as the baby hits the pelvic floor, it starts to do its turn. And it might cause an increased pressure, like an urge to have a bowel movement. And then as the baby's emerging from the vagina, that's when you get that ring of fire at the perineum. So pushing and birth, your nurse is one-on-one with you, or the midwife, or both. Sometimes the OB's in there too. It just depends on if there's concerns that we have. Most women will start to feel more empowered at this stage, and it actually feels good to push because you're not passive, right? They're not just washing over your body. You're using them to do something. And with an epidural, we might labor down, even though you might be completely dilated. If baby's still high, if we labor you down and we do things to open up that lower pelvis, different positions, then it might be less of a physical effort that you have to do with that epidural. And then the placenta. So I have a picture of scuba divers. That's actually my family. And once we started scuba diving, I had so much more understanding of the role of the placenta. So when I'm scuba diving, I have the regulator in my mouth and I have oxygen on my back, or nitrox, a blended oxygen that allows for me to go deeper. But the placenta is the same for your baby. You can picture like the little umbilical cord is the regulator, right? And so the placenta's role is really, really important. So that's why it's important that we give the placenta the time to let it separate. So the uterus continues to contract to deliver the placenta, usually within 5 to 60 minutes after the baby's been born. We do delayed cord clamping, so we don't clamp and cut the cord right away. We'll invite partners or moms or grandparents, support people, whoever wants to clamp the or cut the cord can. And then we will offer cord blood collection if you want. We'll collect 1 vial for the baby's blood type, but we can do private banking if you want to, or more popular is the Hawaii cord blood donation, which is public banking, and we'll talk about that. And then after the placenta is delivered, you have the contractions are helping to bring your uterus smaller and put pressure on that spot where the placenta was. So you'll have a nurse massaging the top of your uterus or your fundus. We call it massage, but it's quite vigorous because we really want that uterus to trigger, to really ball up on itself. And then we might use some Pitocin for bleeding or misoprostol, Cytotec. Those things can be used to help with the bleeding also. And you'll be transferred to mother baby unit for the remainder of your stay at Kaiser, which is one of the rooms I'm in right now, usually about 2 hours after the birth. So taking your placenta home, you certainly can, although they will grow wonderful mango trees or banana trees, right? If you put the placenta underneath a tree. However, ingesting your placenta is not medically indicated. I love the idea of it, but if you think of other mammals, they also eat their placentas, but it's not for nutrition, it's for safety. Because if a placenta of a newborn is left out in the open, then a wolf or a predator is going to know that there's a newborn baby around, right? So that's more the reason why wild mammals or non-human mammals ingest their placenta, is to cover the tracks of a newborn baby. And we don't really have that. There's nobody that's going to come in here to find the newborn baby, right? So if you want, most of the people that take it home will bury it. The encapsulation is a very expensive process, and sometimes you can trigger blood pressure issues, like if somebody's had preeclampsia in their labor process and they ingest the placenta in the capsule form, they may then increase their blood pressure, because we think preeclampsia has something to do with the placenta. So in ingesting that placenta, it can spike the blood pressure. There have been people that have gotten group B strep from ingesting the placenta. Group B strep is a bacteria that lives in the vagina. 30% of us have it in our vaginas. Doesn't cause us any problems, but a newborn baby, it can cause sepsis and illness. So we test for it at 37 weeks and we treat it with penicillin in labor. So that's one of those things where they found it in the encapsulated placenta. And if you think of the placenta like the way it's stopping COVID to get to babies, but then it's causing a little interruption to the placenta, they're not as hardy. Then, you know, with flu, RSV, and those viruses too, I would not want you to ingest the placenta just in case those things are lurking there still. So that's our kind of 2 cents on the trend of the placenta encapsulation. So cord blood donation versus banking. So private banking, you pay a certain fee on an annual basis, but that is your baby's stem cells left for your baby. Thankfully in Hawaii, we have public donation. So after the baby is born and we clamp and cut the cord, then before the placenta is separated, we can collect the remaining blood that is in that cord. And they've just reduced the amount that's necessary to 110 grams. And so that's something we ask everybody on admission if that's something you would like to do. Because of our delayed cord clamping, sometimes though at a minute of life, we'll notice that the cord looks a little thin, so we'll just leave it for baby and not rush to get the cord clamped and cut if we don't think there's going to be enough. The benefit of public donation is there's no cost, and if it's not for your family, but it can help others. It's also, you get a phone call, or not a phone call, a thank you note if your donation is used to treat an illness, and you'll not get the person's name, but generally their age and what the illness was. And then as a collector, I get a little notice that says that what I collected from you has been used. So that's just kind of a great way to get feedback from your donation. So just to pay attention again to the placenta, we will give you a tour if you want to look at the placenta. There's a pattern that's like a tree of life. And so when you look at the trunk of the trees and the branches that are above it, the placenta has that same appearance. So this is one of those pictures of which one is the tree and which one is the trunk, or the tree and which one is the placenta. And so the placenta has the white cord and the tree has the black trunk. So that's the difference. But they do look so beautiful and similar. So we can also, if you don't want to take it home with you, I highly recommend taking pictures. We can do placenta art. And then when we show you mama's side, we can pull the membranes around and show you baby's house too. So coping techniques. So you've seen some in the video that you watched, and we'll have some others. I think it's important to reassure the partner, your support people, that as labor approaches, you might feel excitement, you might feel anxiety, and everything in between. And you're not alone. Most expectant partners experience conflicting emotions, and you might be concerned about your ability to support your partner in labor and delivery. Will help you. And that's where it's so nice to have two people. In that first video with her sister being there so he could rest. And then the next video, you'll see there's lots of people around that can help and step in. And sometimes just knowing what to expect. So again, preparing, which is what this class is. Much of the fear and the anxiety can disappear if you know what's going to be expected. We can prepare, but we can't predict. So your role as a birth partner is to take her safely to the hospital. Like in that first video, you saw him videotaping just their journey, breathing with her and timing the contractions, bringing her water, staying calm, helping her to focus. Sometimes the eye contact really becomes important, and the you know, when you want her to breathe in, lifting your head up and then down, just to kind of remind her to take those deep breaths. Encourage her, tell her she's beautiful, she's strong, she's doing a fantastic job. Touch her lovingly, give her lots of hugs, offer comfort with music, massage, a cool cloth, ice chips, all of those things. Become the rhythm and the ritual for her. So with each contraction and in between, that maybe you're going to do the hip squeeze and then offer her water. Trust yourself to respond to her needs and listen to her and watch for nonverbal cues. Take good care of yourself, eat, drink, and rest when you can, and we're there for you also. And ask any question. You know, if you're concerned about something, just whisper it to us. One of the things to not do, though, is to shout out, she's tired, she can't do this, right? Those are deflating expressions. If you're concerned that she's tired, come over and whisper it to us, okay? The moment you put that out into the room, or if she thinks that you believe she can't do it, then she's going to give up on herself too. So breathing becomes really, really important. It's an automatic response to pain, right? If you get your shin, you breathe fast. Provides a sense of well-being and control, increases your oxygen, provides more strength and energy, brings purpose to each contraction, vocalization. And the next video that we play, you'll hear she reflects on her birth and that just sounds just came out of her mouth, but it felt better. You know, I like that. Avoid holding your breath. And breathing helps when you want to push or bear down and it's not the right time. And sometimes when baby's crowning, I'll have you breathe instead of push with the contraction, just to allow the perineum to stretch. So if we just take a moment and close our eyes, we'll just do a little box breath, just kind of a nice calming breath to take. And just so take a moment to just breathe through your nose, out through your mouth. And again, your videos are off and I can't hear you, so just be comfortable in your own space. There's no judgment. Opening your hands on your lap and letting them just be loose. Pay attention to how you're sitting. Maybe you want to sit up a little straighter. And this box breath that we're going to do is it to the count of 4, and how it works is you're going to breathe in to 4, and then with that inhale you're going to hold it for 4, then exhale for 4, and then pause with that kind of the exhale, the empty space. So I'll count it out. Breathe in, 2, 3, 4, pause, 2, 3, 4, out, 2, 3, 4, pause, 2, 3, 4. We'll count one more. Breathe in, 2, 3, 4, pause, 2, 3, 4. Breathe out, 2, 3, 4, and pause, 2, 3, 4. Do another cycle just on your own. And one more. And just having done 4 cycles of that type of breathing, just feel how your body feels. Are your shoulders a little looser, your face a little bit more relaxed? Is your jaw loose, your tongue resting toward the top? And that's when you close your eyes too, you get rid of 80% of your stimulation, right? It really helps. And then when you're ready, just opening your eyes. There are other videotapes or YouTube videos that you can watch with different breathing techniques Lamaze used to be the childbirth education technique that was more focused on the breath. And even Lamaze has kind of gotten away from it, and just the importance of taking deep breaths and focusing on your own breath. So here's a picture of our tub room. So they're nice and deep tubs. There's not usually enough for two, like in that first video. I love the idea, but generally just one person in there. I suppose we could have two, but we can bring in a chair. You can have people nearby. Making sure for comfort, maybe beverages, bring in your own water bottle, movement, position change, the hot or the cold, touch, massage, and people get to a point in their labor where they're like, don't touch me, and that's a good sign too. Aromatherapy, focus, distraction, the guided imagery, music and dance. I love it to see, you know, partner, you're leaned up against your partner's back and they're lifting your belly for you while you're just swaying back and forth, and then vocalization. So these are actual positive affirmations that one of my clients put on the back of the mirror that we have in the room, just so that her partner could have something to whisper to her, or she could glance up. I love that I'm a badass mama bear, right? That's just they're all positive. That we all get to that point in labor where we want to shake our heads no, you want to just make yourself nod, right? And then position for labor. I showed you the birth balls that we have. You can sit on the toilet, walking. Our beds can do all kinds of things. We can get you squatting, side lying, standing, and those are all for birth too. Like, we'll work around you. Again, create your space to make it seem more like your home, right? So you've got your personality there. And then for packing your own clothes, we've talked about pillow, aromatherapy, creating your space, your speaker, charging cables, something to make you laugh. And then you may want to put in a little tiny bottle of coconut oil or almond oil, or even olive for the perineum, for when the baby is crowning. We have mineral oil. I can't get the hospital yet to stop with the mineral oil. Mineral oil is slippery, but it stays on the surface of your skin. Where coconut oil or almond oil, your skin absorbs it and it becomes more elastic, right? So if you want to bring in your own oils, you can. So this video is a young girl who's well supported by her family.
Alex is a single, first-time teen mom. Her labor starts late one night with contractions. She labors at home with the support of several friends who provide emotional support and help her time these early contractions.
I knew I was in labor because my contractions were harder. I was really uncomfortable, and I was just really, I didn't want to talk.
How you doing there?
I decided it was time to go to the hospital when I couldn't talk during my contractions. And I really was concentrating on my breathing.
Alex's friend calls her healthcare provider.
Hi, is Diana there? Yeah, could you page her for me? Well, Diane told us to call her when Alex was gonna head to the hospital. All right, thank you. Bye.
Alex arrives at the hospital and the labor nurse checks her cervix. The nurse suggests that Alex drink some water.
If
she's contracting because she's dehydrated, it'll calm them down. If she's contracting because she's really trying to go into labor, it will give her uterus what it needs to be more effective to change her cervix. The water's a win-win.
The nurse also suggests that Alex get up and walk around the hospital to see if it strengthens her contractions.
You have to walk for an hour?
Yeah.
When I was in early labor, I walked around and tried focusing on my breathing when I had a contraction. I walked up and down stairs too. Stair climbing just relieved the pressure in between my legs, and just to stand up helped.
Well, hello, beautiful. Go one more time. 500. Up and down.
After an hour of walking, Alex's healthcare provider arrives to check her. She finds that Alex's cervix hasn't changed.
Home you go, at least for a while.
She advises Alex to rest at home until her contractions are stronger.
All right, but I do want you to sleep. The best thing you can do.
We are
is
going to go
sleep.
home and go to sleep.
Right.
After resting throughout the night with milder contractions, Alex and her mother return to the hospital the next morning when her contractions are stronger and more frequent.
During active labor, my contractions were harder, and focusing was harder because they hurt worse, and it was just harder to keep my mind on something and just stay on it. My hips felt like they were spreading, like really, really far apart. And to help me try to get comfortable, I had my mom rub my lower back and press on it.
And sometimes too, at the same time, you're pressing your hip. This kind of changes the way that our pelvis structure feels. It's kind of going, and it gives more room.
Does that feel good? That feels good. Yes. Teach me how to do this. Okay.
So if you're feeling like right where her hip is.
Okay.
Her just squeezing the side of my hips together just felt really good and just kind of took pressure off and didn't really let me think about the next contraction. So I got in the jacuzzi for maybe an hour and just stayed in there and relaxed.
When she was in the jacuzzi tub, one of the parts I really liked, I think that helped her a lot, was the shower massager thing. The nurse had given us the idea to put that on her tummy, just right against there with the water coming out for the pressure, and I just rubbed that around and around on her tummy. Actually, I liked that because that worked for quite a while. So that was like I was just relaxing for a moment before the next phase.
Let it go. Just breathe. Do you want me to count, or does that really, it just irritates you? Okay.
I was all trained and focused in the counting, the 1, 2, 3, 4, which Alex did not like at all. She didn't want anything to do with mom counting, so I had to throw that out the window, and I was a little lost, but that's one thing they taught us in the classes is, you know, as the coach, you have to be ready for anything.
See, there you go. Great.
Contractions intensify even more as Alex enters transition, which is usually the shortest but most challenging phase of labor when the cervix dilates completely.
The techniques I used during transition was laying on my side and just squeezing the bar that I had on my sides of the bed and just breathing really hard.
Trust your body that it knows exactly what it's doing. You're doing wonderful.
That's a good one, Alex. That was good.
Moaning came naturally, just because when I had a contraction, I just felt like, it just came. I didn't do it, it just came. Just when I did moan, it felt better, and I didn't think about the contraction as much.
Here's just beautiful.
Hi.
During the transition phase, she was extremely agitated, but I knew in my head and in my heart that it was almost over. We were at a point where it was done, but trying to convince her of that and just be real encouraging. I mean, my voice got deeper, and just really had to like try to get in her face. I remember trying to get eye contact.
You're doing so good. You really are. I'm so proud of you. I know. You're doing really good. Breathe, sweetheart. Don't fight it, breathe.
From my support people, I really needed them just to let me squeeze their hands and just to sit there and tell me I can do this and not let me down.
Alex requests that her healthcare provider check her cervix to see how far she is dilated. Alex's healthcare provider will break the bag of waters to help Alex progress to the pushing stage of labor.
When I break the bag of waters, it's going to feel like a warm waterfall, but it'll probably feel like a lot more pressure down. You're 9 centimeters. I think you're probably almost ready to push the baby.
Oh my God.
During the pushing phase, I stepped back because Justin, the baby's daddy, was there at the time. So I just got to stand there and really watch him just come. So.
Okay, take a deep cleansing breath. Big breath in and out.
Emotionally, I felt relieved to push, and I couldn't wait to see his face. I wanted to just finally hold him and give him a kiss and be done.
After just a few short pushes, the baby's head starts to emerge.
Look at all that hair, Alex. Lots of hair. Baby, you're doing great.
Just perfect.
Just good.
Now take a breath. Gently.
Okay.
Gently.
Okay.
Gently. Gently.
There you
Now you can rest your head back.
When the baby came out, they laid him on top of me. I was really excited and happy. I felt so much love, I can't even explain it.
Okay, Justin, got your son out into the world.
Go for it.
Yay.
There he is.
There he is.
To have all the people witness the birth was exciting, and it helped with the support that I had from all of them in the room.
So cute.
I have never been on the receiving end of being able to watch a birth. So actually being able to see him born, it was awesome. And I look at my daughter and I'm really proud of her.
I decided to breastfeed because I heard that they get more protein and stuff like that, and it's better than bottle feeding.
We might just pause for a little bit. Just let him kind of, he's learning how to suck, swallow, and breathe all at the same time. He's learning just as much as you are, so. And then before you know, oh yeah, he's got a good latch.
Emotionally, I felt good with it. I felt confident with it, and I thought it would make a better bond between me and him. Childbirth has affected my life a lot. I have someone who depends on me now, someone who relies on me, who I have to wake up to at night, who just needs me all the time. And that doesn't stop. And he's my number one right now, and always will be.
So all of the support, really working hard for her, but her vocalization was wonderful, right? And also just the going home, that sometimes you come in and there's the practice contractions, but the cervix hasn't changed. So staying positive is really, really important, and affecting all of those hormones, right? So all women experience some discomfort and pain during labor and delivery. Some people will call them rushes or surges, trying to avoid, the word pain, because it is different. It's something that's pushing baby out of your body. And the pain intensity varies from woman to woman. So even with pain medication, you'll still likely feel some form of discomfort during your labor. So we've got unmedicated birth. We have IV pain medication that we use fentanyl, epidural, and guided imagery. You can use that with everything, the water. And then we have the morphine and the Phenergan, more so if you're in a prodromal labor or very early stages, and just need to get some sleep. So epidural, there's advantages in that the comfort is long lasting until we turn it off. And it facilitates labor by relaxing mama, right? Takes away kind of that, some of those hormones, but we hope the oxytocin one is at a nice high level to continue. So the disadvantages is that by relaxing you, we relax the blood vessels, and so your blood pressure can drop, which is affecting the placenta. You do need to have a catheter in. Some people will experience a pins and needle sensation. You do need to remain in the bed, and then you can only have ice chips at this point. And also being realistic with the epidural, it's not going to take everything away. Usually just the sharp pain, but you'll still feel like the pressure sensations. And then you'll want to have bad posture to place it. So the epidural is placed with a needle, but then the needle comes out and the catheter is what's left in place. And so you want to open up your spines by shoulders going forward and rounding out your back. So when the lady's in a green light position, that's a good position, like a C. So this is a video with an epidural, so you'll actually hear the consent for that, and just see the difference. And you can also hear the feistiness too, that can come from labor, which is normal.
My name is Chelsea, and this is my first child. We're having a girl. I'm really excited.
My name is Cameron. I'm just so excited of, I don't know, just holding my own child in my arms. It just excites me.
I could really wait for her to come another week or so, but I'm getting really anxious to see what she looks like and have her in my arms instead of in my stomach. And my midwives are saying that she's ready to go. I am having a lot of warm-up contractions. That means she's getting closer. My labor started early on Sunday morning. I noticed that my mucus plug came out, and after that, it was followed by contractions. In the very early part of labor, when the contractions were still far apart, they actually told me to walk around.
When Chelsea first arrived at the hospital, she walked around the halls and sat in the tub. It's now several hours later, and she is experiencing stronger contractions.
When Chelsea was having contractions, I came by and sat by her and held her hand and just talked to her, tried to soothe her through it, just telling her that it's going to be okay and it's just going to be temporary.
As far as breathing techniques, I just made sure that I did deep breaths in and deep breaths out and just focused on my breathing in.
When her contractions started getting a little harder, I just laid back a little bit and just held her hand and just listened to what she wanted me to do, because her mood was getting a little short because she was in pain.
Get off the bed, please.
I decided I wanted the epidural when I could no longer take the pain. Once I lost control of my breathing, and once I felt like my breathing wasn't helping anymore to control the pain. I was 5 centimeters and 80% effaced. The anesthesiologist came about 10 minutes after I requested the epidural.
And then I go through with a larger needle and I go by feel. And if this was the needle, I want it to stop right before that surrounding around this spinal cord. And then once that sits there, it's hollow needle, and I'm going to go through with another small needle, pop through that surrounding around that spinal cord. It might not hurt, it just might feel really, really intense as far as pressure goes, okay? Any questions about the epidural I can answer for you?
Chelsea signs consent forms and is given fluids through an IV. It will take about 15 minutes to administer the epidural.
I'm going to work back here and do a few things, okay, Chelsea?
The anesthesiologist talked me through the whole process, so I knew what was going on the whole time.
The anesthesiologist injects a local anesthetic.
That part was kind of painful because it was like a stinging sensation. Immediately after they started administering the drugs, it worked really fast.
Just hold her hands or something for her, okay?
When she was receiving the epidural, they had me stand in front of her and hold her right hand and just calm her while they did it. My job was just to support her.
Okay, you can sit anywhere you'd like to. Okay, butt feeling warm, toes feeling warm, that's all normal.
So that means everything's okay?
Yep, that means it's working.
This is great.
Once I got the epidural, my labor became a lot easier. I was able to rest, not be in pain, basically. So I didn't really progress after I got the epidural very quickly, but I was able to get rest.
Well, once the epidural took effect, it was a lot more relaxed. She was relaxed and she just wanted to rest, and we were just waiting.
About an hour after receiving the epidural, Chelsea's healthcare provider comes to check her cervix.
You are 5 centimeters, totally thinned out, so 100%.
The nurse helps Chelsea change sides, and Chelsea continues to rest throughout the late afternoon and into the early evening. Since the hospital staff has changed shifts, a different provider comes in to check her progress.
You're like 5 centimeters.
In the past few hours, the baby's head has descended low enough for Chelsea's healthcare provider to break the bag of waters, which she hopes will help Chelsea's progress.
So I can break your bag. You're having a contraction right now. Can you feel it?
They decided to break my water to help speed the process up. When they broke my water, the procedure was kind of uncomfortable.
There's your water. Ooh, there's that. Nice. Wow. Waterfall. Yeah. It's a nice, clear.
Clear?
Clear fluid, yeah.
But it wasn't painful. It was just for the most part uncomfortable. Once they broke my water, the labor didn't speed up very much. I stayed at 5 centimeters for a few more hours after they broke my water.
You're the same.
I wasn't really frustrated. I was more worried and concerned that I might have to deliver via C-section.
When we broke your bag of water, the head came down quite a bit, but it's still kind of loose in there. The head isn't really strongly applied to the cervix. The Pitocin,
They suggested that we try Pitocin to speed things up.
the Pitocin is just going to increase the contraction so that the head comes down more against the cervix. Okay, so Jane will come in and start that medicine here shortly.
Pitocin is an IV drug that is used to strengthen contractions. The nurse starts the IV and will turn the dosage up or down as needed.
Once they gave me the Pitocin, it did start to speed things up, and it also made the pressure a bit more intense. And it took about 6 hours to progress from 6 centimeters to 10 centimeters. So it did take a while for the Pitocin to work. I was sleeping when the nurse came into my room, and she woke me up to tell me that she was going to check me. Right after she checked me, she told me that it was time to push. Yeah, that was a nice wake-up call.
Well, I was actually asleep when she woke me up and told me it was time for her to push.
I'm ready to push.
And I was still kind of dazed, and she said that, and I was like, push what?
Because I had the epidural, I wasn't able to feel my contractions. So I was instructed to put my hands on my stomach and feel for the contractions. When my stomach tightened, I knew when to push.
There you go. Come on, Maya.
By the time I started pushing, my contractions were spaced about 6 or 7 minutes apart, so I had a long break in between pushing each time.
Chelsea continues to push steadily for about 25 minutes until the baby's head appears.
See your hair is curly, dark black. Come on, girl.
I didn't feel much of anything except pressure until her head actually came out.
Yeah, let it just breathe. This is that point I was telling you about. Just try to relax.
Okay, come on.
You don't have coffee, it's good for that.
Okay. Oh my god. Yeah? Are you ready? Okay.
Physically, once she was born, I felt so much relief. Emotionally, I cried. I was very happy, and I felt like I finally did it, and I was really proud of myself, and I was in love with her immediately.
Yeah, they make pretty babies.
As soon as she came out, all the love I have went straight to my heart, you know, and I seen her and I was just amazed and so happy.
The first time I breastfed Kamaya, I really felt really close to her, and I felt like I was her link to life. I was really proud that I was able to get her latched on by myself because I had no idea what I was doing. So it felt good to get her on and get her eating so soon.
The joys of having a newborn, I feel just seeing her grow every day and seeing her personality and her attitudes, just seeing the traits that she has from me and the traits that she has from Chelsea.
Whose nose is that? Those are mama's eyes. We know that. Don't be rolling your eyes at me.
The best part about having her is looking forward to the future, knowing that she's going to change every day, and I have something to look forward to every day as far as her personality changing and her first day of school and all the big milestones in her life.
Super. So that it looks a little different with an epidural. Plus, she had the augmentation of the breaking the bag, opening that bag of water. And then when that didn't work, they added on some Pitocin. So that's the synthetic oxytocin. So we use that in an induction process also. Sometimes we induce labor due to medical complications, diabetes, high blood pressure, preeclampsia, if you're very overdue. COVID disease in pregnancy was also at one point a reason for doing an induction. We've no longer been able to keep up with that. So we do not do an induction for COVID anymore. Body mass index, if it's higher than 35, we'll recommend an induction around 39 weeks. If you are over 40, we will recommend earlier induction and other maternal conditions. Sometimes baby tells us that we need to do an induction of labor, and that could be if they're not growing as expected, they're a little less, if there's signs of fetal distress, less fluid around the baby, if there's a congenital anomaly, or other newborn medical condition. So generally, if you remember the thumbs up to the skin between the thumb and the pointer finger, sometimes we need to use medicine to help soften the cervix. So that's usually misoprostol or Cervidil or a cook balloon. So those are our three options. Generally, the cook balloon we place when the cervix is at least a centimeter. It's a little balloon that goes deflated into the cervix, and then we inflate with some fluid, about 80 cc's of fluid. So you get the weight of the water as well as the mechanical dilation. So once you have a favorable cervix, so it's thinned out, a little bit more open, softer, moved forward, and baby's nice and low, we can enhance the contractions with using the IV Pitocin. So cesarean section, we'll talk a little bit about that. I think it's best if we just go right to the video and then we'll talk about it afterwards. So this is Daniela's birth. That ends up, so not a planned C-section, but this is a C-section recommended during the labor process and not an emergent one.
My name is Daniela. I'm 38 weeks pregnant and we're having our first baby girl.
Me llamo Oscar y estoy bien entusiasmado porque vamos a tener nuestro primer bebé.
From the last visit to the doctor, the baby's dropped and I'm about 1 centimeter dilated already. So I'm pretty sure baby's ready to come out any minute now.
A few days after her due date, Daniela's labor begins.
When I first started getting contractions, they were sort of like menstrual cramps, and by the time we had to go to the hospital, they were a lot stronger and they were every 5 minutes. When we first arrived to the hospital, we were in the triage center, and after about an hour in triage, they sent us up to the labor and delivery room.
Once in her labor room, Daniela requests an epidural for pain relief.
When I got the epidural, my contractions were, for me, extremely just strong by that time. A lot of the pain I was feeling was in my back, and it was due to the fact that she was posterior.
3 hours after getting the epidural, Daniela's midwife checks her cervix.
So no es muy rápido por 3 horas. Una cosa que podemos hacer es romper la bolsa de agua.
Daniela's midwife suggests breaking the bag of waters in an attempt to speed up progress. After further discussion, the midwife uses an amni hook to break the bag, which is a procedure similar to a vaginal exam.
So I will kind of check your cervix again about 10 o'clock or so. Okay. In the meantime, try and get some rest.
At 10 o'clock, the midwife returns to check Daniela's cervix.
Still about 5 centimeters. Okay. So this is going to help us know if you're contracting.
Since she is still at 5 centimeters, the midwife inserts a tube into Daniela's uterus, which will help record her contractions more closely. And she attaches a monitor to the baby's scalp for a more exact reading of the fetal heart rate. In another attempt to help progress, the nurse starts an IV of Pitocin, which is a drug that strengthens labor contractions.
This we just start off at a really small amount, and we turn it up depending on what your contractions are doing.
The amount of Pitocin Daniela receives can be adjusted as needed. Daniela is given an hour to rest and allow the Pitocin to work. Around 11 o'clock, Daniela's midwife performs another cervical check.
The only difference is the baby's cone head.
Daniela is still dilated to 5 centimeters despite receiving Pitocin.
So voy a hablar con la doctora, pero pienso que con las contracciones por 2 horas y la cuerda matriz es igual.
They suggested cesarean when they checked me to see how far dilated I was, and during the whole labor part, I only dilated to 5 centimeters, and I had an infection, so they were afraid of I didn't have the cesarean that something would happen to the baby.
Probably be in the operating room for a little over an hour. The babies usually have to about 10-15 minutes. And that part's fast.
Cuando me enteré que iban a hacer una cesárea, me sentí mal porque teníamos planeado hacer parto natural.
At that point, I believe I was disappointed because I wanted to be strong and have a natural labor. The thing that helped me the most to get through the disappointment was having my husband there with me and supporting me in everything and making sure that I was okay.
I'm Dr. Renner. I'm one of the residents here at the hospital. Nice to meet you.
The obstetrician who will perform the cesarean explains the consent form and talks about the surgery, including the possible risks.
The things that were going through my mind was more that I was scared when we were signing the papers.
Daniela signs the necessary release form and is prepped for surgery. She already has an epidural in place, so the dosage will be increased during surgery as needed. Oscar changes into scrubs because the operating room is a sterile area, and he will be with Daniela to support her during surgery. Next, Daniela is wheeled into the operating room.
The room was really, really cold, and I had a fever at that point, so it was scary and not scary at the same time because my husband was there with me the whole time.
Durante la cesárea fue ayudarle, decirle que todo iba a salir bien, de darle ánimos, y le agarraba su mano.
During the surgery, I felt when they pulled her out of my stomach, and at that instant, my husband, he told me, "It's a girl."
Cuando yo la vi, le dije a mi esposa, es una niña, y yo lloré. En ese momento lloramos los dos.
I was not able to touch my baby right away, but my husband was, and after they actually cleaned her, he was able to take her over towards me, and I couldn't really hold her. I kissed her, and I got excited, and I cried.
Oscar carries his daughter to the nursery. In the nursery, the pediatric nurse assesses the baby, which is common for babies born by cesarean.
Right after she was born, I was taken into a room where it was a recovery room, and right away I got to breastfeed her, and that was exciting because I was actually able to hold her, and it wasn't hard for her to latch on. It was hard for me because I couldn't really sit up straight. Emotionally, it made me happy inside because it made me think about having her here already and thinking of the whole process and that it was all worth it just to have her here with us already. The recovery at home was pretty difficult because I couldn't do things for myself. He had to help me bathe and cook, and my parents had to come over and help me clean the house. So it was weird because I'm so used to doing things on my own. I felt depressed at first, and when I started talking to my husband about it, he would tell me that it was okay. I mean, it was something normal that happened to a lot of people.
A los padres que van a tener un hijo, les diría que apoyaran mucho a su esposa, que estuvieran siempre con ella, porque a veces pasan dificultades, que pues cambio de la mujer.
It surprised me that I did need a lot of support. I needed support from people that had already had a cesarean, to know what they felt, to see whether or not what I was feeling was normal. And it did help me because my mom did have a cesarean, and my mother-in-law had a cesarean, so they've helped me a lot. Breastfeeding has actually been going really good. I thought we would have problems with her latching, but it's actually been going great. I am glad that I decided to breastfeed because it gives me a chance to bond with her even more.
De tener a mi hija alguna vez yo la soñé y ahora mi sueño se ha hecho realidad y es algo maravilloso que tengo.
The most special thing or the best thing is just having her here.
So for Daniela too, I think she makes an important point about the help that she needed postpartum, but that's not unique to having a C-section. I think even with a vaginal delivery, it's nice to have people cook and clean your house for you because you're busy with your newborn baby. And the baby blues are about 75% of us have the baby blues for about the first 2 weeks. So we don't diagnose postpartum depression in those first 2 weeks. It would be after And it's repetitive bad thoughts is kind of what gives you the diagnosis of postpartum depression. So in her situation, her C-section was a non-urgent one. Basically, her baby was in a facing upright and was not turning. And so her labor stalled at 5 centimeters, which means she really didn't even get into active labor yet, right? Staying at that 5 centimeters, even though they broke her bag of water and gave her Pitocin. And then she got an infection in labor too, so they would have probably treated her with antibiotics through the IV. Very systematic, and slowly make it to the operating room. An emergency C-section would be more baby, the heart rate goes down and it stays down. If we do see what's called a deceleration of the heart rate on the monitor and it lasts or goes quite low, several people will be in your room all at once and will be explaining to you what we're looking at. And the first steps are to move and shift position. But if it does stay down, then we would do an emergency C-section. So we have 2 operating rooms here on Oahu. So again, my apologies to Hilo and Maui. The specifics of your hospitals, you will really have to check in with your group. I'm not sure if they're doing tours. I know we have not done tours yet, but you may have a conversation when you call labor and delivery or with your providers for the details of that. But we have 2 operating rooms that are right here on the floor. Our nurse anesthetists do the epidurals and they would go in for the surgery. If you already have an epidural, then they would make sure that it is adequate or they dose it a little heavier. If you don't have an epidural and it's an emergency, generally you would go to sleep for that surgery. And whenever somebody goes to sleep for the surgery, then they cannot have somebody with them at the time of the surgery because of the urgent situation. So sometimes a C-section can be scheduled. So like the first video that we saw, her baby was breech, so she had a scheduled date to come in. We can try to turn babies that are breech, so it's called an external cephalic version, but that is not without risk. So we'll go through that and you get to decide if that's something you'd want to try. And sometimes the C-sections, when they're not planned, and they're non-urgent, it can be lack of progress of the cervix for dilating. Sometimes baby doesn't descend into the pelvis. In my experience, if the baby's too big to get into the pelvis, generally we'll see that. Fetal distress, the heart rate, or if somebody has a herpes outbreak to the vagina at the time of delivery, we will recommend a C-section for that too. And though it's very common, it's still major abdominal surgery and it requires special care for yourself. The recovery is usually about 8 more weeks. So you do get out of bed relatively quickly. You want to make sure to take nice deep breaths so that you don't get a lung infection. We really do schedule medication, not always opiate. So even Tylenol and Motrin can really help with that C-section recovery. There are risks, so bleeding, organ damage, and infection. So the consent form she signed, that's what she was discussing with the doctor. And then passing gas is important after your cesarean, so we really do want to hear about that. And you can be kind of gassy and it can be quite uncomfortable. And so that'll be important for your bowels and bladder to return to normal. So the postpartum period, you did it. You'll be at parenthood. So make sure to check out the newborn postpartum course on kp.org. That one is recorded. So baby goes skin to skin. You've heard me say that a few times. That promotes breastfeeding, regulates the baby's temperature, and they stay warmer, cry less, and nurse sooner when they're skin to skin with you. Birth partners get a chance too. When the mama gets up to the shower, that's a great time for Papa to take off his shirt and put baby right on skin to skin, unwrap baby, and then put a blanket over the 2 of you. So you'll be given identification bands. So baby has also a little alarm band. We are a locked unit so that we keep everybody, all of our families safe. And so the baby has a little alarm that if it were to go past a certain spot, it would announce, stop, stop, stop. So you also will all have matching ID numbers. The only time the baby leaves your room postpartum is if you choose to have your baby boy circumcised, or for the hearing screening, and all babies go for the hearing screening. So for the hearing screening, babies usually go alone, but the guy who runs that, he's so dynamic, puts his name on the board, shows you his badge and what room that he will be in doing the test. So your recovery, you'll stay in the labor room for about 2 hours. You might feel relieved, ecstatic, exhausted. Usually breastfeeding is started in those first 2 hours because baby's awake for 2 hours and then they're asleep for 24. So that's really that window to get breastfeeding started. And most babies and parents experience a period of alertness and curiosity for those first 2 hours, and then everybody gets really tired. After the 2 hours of bonding, breastfeeding, recovery, mom and babe need rest, sleep, and then take this time, this early days, to just talk to baby, touch, hold, sniff your newborn. And then remember that postpartum recovery is not about just recovering from birth, but the whole dynamic changes that took place during your pregnancy. So you've got this, you can do it, trust your body, call us with questions or signs or symptoms of labor, and it's okay to park at that roundabout. There are the 2 places that are marked with a stork. You can move it later. You can go to the car park if mom is able to walk. There are wheelchairs at the front door if you need them. Usually there's security down there too, and our number is posted if you need us. You just go straight up to the 6th floor Family Birth Center. There's a little intercom that you press the button for, and then you'll come into labor and delivery. It's the same entrance to that area for postpartum too. So you do not need to stop on the 1st floor. There are no papers for you to file. We have your entire medical record here with us in the Epic medical records on the computer. So thank you for allowing us to be part of a very special time of your lives. I hope that this class has made you more prepared, and also that you know that we've got you, right? We will do all that we can to achieve a healthy, normal birth for you. This poem is just a reminder that there's a lot of special fancy language that's thrown out there, and the memorization of the active phase and the early phase and pushing and all of that. But in reality, your body knows what to do. You don't need to know all those fancy words. You just need to really trust your body. Okay, so questions at all? I am going to get out of my shared screen view and look at the chat if there's anything. Yes, skin to skin in the OR as well. And support person can bring a phone or a camera for photos in the operating room. And some of our physicians will let you play music too, which is so lovely. Okay, and then I think John is going to do the recording. Looks like he's already posted that. That's the full version, so he will edit eventually and I think put it on YouTube, so you could always call in a couple of weeks and ask the ed department that you signed up for this class with, and they can probably send you an email link. And let's see what else is in our chat. Okay, I'll stay on for just a little bit, but I know it's late. Again, thank you for understanding that Sunny and I are doing this outside of our other full-time schedule. But it's just lovely to be able to spend 3 hours talking about what your amazing bodies are going to do. Thank you, everybody. Sleep well and take care. And I'll see you here, labor and delivery. Good night. Thank you.
Thanks, Jen. Thanks, Sunny.
Thanks, John. Thanks for staying on, John.
Hi, Jennifer. This is hi. I just wanted to confirm the Kaiser Welcome to Kaiser webinar that happened maybe a week or two ago.
Yeah.
Did you guys have that? Because I joined on it and it never let me in.
Oh, well, that one's more for earlier in pregnancy. There is a recorded version of that too. It's actually on YouTube.
Oh, okay. Okay, I'll
Yeah,
take a look
so
at that.
yeah, if you are, because you come to YPO, right?
Yes, correct.
Yeah, so I can give you there's a dot phrase for it.
Oh, okay.
Yeah. Do you know who you see next?
I school tomorrow and it's what was her name? I mean, it was a doctor and I haven't been to her yet, so I don't know.
I can put on the I can look for it and put in the dot phrase for the link. There's a picture and then there's like a title with an underline, and on your after visit summary on the desktop, if you click on that, you will be linked to the video.
Okay, okay, thank you so much.
You're welcome.
And thank you so much. It was very informative. I really appreciate your time.
You're welcome. Thanks so much. Have a good night.
You too.
Sleep well. Bye-bye.
Bye.